All right, I think we're ready to go. You guys ready? Okay. We have a jam-packed agenda today, so I hope you're as excited as I am about it. We really tried to find things that would interest both people in healthcare, people outside of healthcare. We're going to try to address some of the hot-button issues happening in Northern Colorado in healthcare. So, yeah, we're going to go ahead and get things going and make sure we have enough time to get through everything. So my name is Jonas McKinley. I am with UCHealth. UCHealth Plan Administrators is the division I'm with, and I'm also with the Northern Colorado Health Sector Partnership. So how many of you guys have been to this event in prior years? Okay, so hopefully you've seen me at some point talking about the Health Sector Partnership. It's been an ongoing effort, and we're going to talk a little bit more about it in a second, but I've been a long-time participant in that and part of the leadership team. So hopefully you're going to notice some differences in today's agenda and today's event, and a big part of that is kind of a transition that's happening with the planning of the event. So the Fort Collins Chamber of Commerce started this event. They've shepherded it now for 11 years, I believe. This is the 11th year. So it's been a long time event, and this year they actually approached the Health Sector Partnership leadership team and asked us if we might want to take over the planning of the event. They would stay on to help with logistics, help with certainly some of the things that are necessary to make this happen, but that we would help plan the agenda and kind of take over some control. The carrot and part of that offer was that they would also let us keep the proceeds from this event. And we happily accepted that. It's a very generous offer, and we were very excited as a leadership team to kind of take over the planning of this event. And again, the goal is going to be to grow this event over time and make this more of a business event, bring in more people from outside of healthcare. So show of hands, we're going to do a couple of these, so I appreciate you guys participating. How many of you guys are in healthcare? So that's a lot, right? The goal is next year, we're going to try to get more business and community members here. So the takeaway from today's event, hopefully it's going to be, like I said, a very impactful agenda, and you'll take that back to people outside of healthcare, constituents in the community, people that you know that might be interested in knowing about this stuff, and then next year we'll have more representation from people outside of healthcare. That's certainly the goal as we grow this thing. So the agenda today, I've mentioned it a few times, was really driven by conversations that have been happening within our health sector partnership. So we have a lot of different committees, a lot of different issues that we're addressing, and we're trying to give you guys a sampling of kind of those key issues, hot button things. Hopefully these are things that you guys are being asked about, that you're working on, that you're aware of, and that will be meaningful to you. So I'm going to do a couple of things, some housekeeping items. So on the table, you're going to have a QR code. And it's also on the screen right now if you want to whip out your phone really quick. That will get you to our program. So if you want to kind of follow along and not have to stare at the screen the whole time and stare at your screen in your hand, this is a great way to do it. So make sure to get your program there so you can use that QR code to do that. The other thing, again, we have food and beverage. We're going to have beverages all morning, so if you need to grab some coffee, we are going to have a break halfway through our morning, so you'll have a chance to run to the restroom, get some more coffee. We'll have some soft drinks as well. If you didn't get food and you want to get food, do that as quickly as possible. There's still food out there, and that should be out there for a little bit longer. And the next thing I want to do is thank our sponsors. So an event like this, it's a big undertaking. It takes money to do that. As I mentioned, this is typically a profitable event. This is an event that's going to bring money back to the Health Sector Partnership, help further our efforts. We're, again, working on a lot of different things, so it's a very helpful thing to have sponsors and have an event like this that will bring revenue to our group. So, sponsors, our platinum sponsor this year was the Fort Collins Chamber of Commerce. Gold sponsors were Anthem Blue Cross Blue Shield, Old Town Media, and UCHealth. Silver sponsors were Banner Health and North Range Behavioral Health. Our bronze sponsors, we got quite a few of them, so I'll kind of run through these, were 50 Plus Media Solutions, Advanced Medical Imaging Consultants, Associates in Family Medicine, or Village MD, City of Fort Collins, Eye Care Associates, Front Range Community College, Larimer Campus, iHeart, Orthopedic and Spine Center of the Rockies, Pathways, Senior Voice, Summit Stone Health Partners, and UCHealth Plan Administrators. We also had event sponsors today. Many of them have booths in the back. Allergy and Asthma Center of the Rockies, Centennial Area Health Education Center, Century Park Associates, the Bridge at Longmont, Greeley, and Point Frontier Retirement Communities, Colorado Visiting Nurse Association, Emergency Physician of the Rockies, FNBO, Jet Marketing, North 40 News, Northern Colorado Rehabilitation, Northern Colorado Long-Term Acute Care Hospital, Sinorama, Surgery Center of Fort Collins, and the Women's Clinic of Northern Colorado. Can you guys give them a round of applause for sponsoring this event? Okay, so I'm going to just really quickly go through what the Health Sector Partnership is and does. And our goal is that everyone here, everybody that at least raised their hand saying that they're in healthcare, is a participant in some capacity. And maybe it's not you, maybe it's somebody within your company that you support to participate, but we would certainly like to have your involvement. Hopefully one of these committees that I'm going to talk about in a second would be something that's of interest to you. And we'll have a call of action to get involved at the end here. So have your phone ready if you do want to get involved. So history. It was started in 2013. This is a nationwide model. There are sector partnerships. It's not just a healthcare thing. This happens in lots of different sectors, and there are lots of them happening here in Northern Colorado. Outside of healthcare, numerous new industries getting into it even just this year. So the goal of a sector partnership is that the industry takes the lead, and that is key. So there's lots of efforts out there. They're typically driven by our public sector, and that's great, and we love our public partners, but the private sector really needs to take the lead in things, and they're the ones that know what's happening in their industry and what is going to be most impactful to work on. So the Northern Colorado Health Sector Partnership brings together key stakeholders to promote and improve health within our communities. We collaborate across disciplines, organizations, and communities to seize opportunities, solve problems, and celebrate successes in the region. So that's the mission of the sector partnership. There are numerous different committees. So things we're working on are workforce. We work on work-based learning, career explorations. We have a great event. I've talked about it at this event in the past called Get Into the Guts. It's my favorite name of anything we do, Get Into the Guts. So it's maybe I'm the only one that likes it. Maybe I'm a little too excited about guts. I don't know. Just while you guys like tangents, right? Has anybody seen Shaun of the Dead? Any fans of funny horror movies? So I watched that with my 13-year-old this weekend, and she loved it, and it's like making me really proud as a parent. And anyway, so she now likes guts too, and that's exciting. But it's an event that brings, speaking of middle schoolers, she is a middle schooler, it brings middle schoolers into healthcare facilities where they actually get to see all of the different things that we do. So those of us in healthcare, we're pretty aware that it's not just getting into the guts. It's not just patient bedside nurses, things of that sort. There's all different kinds of careers you can explore within healthcare and right here in Northern Colorado. So we feel it's really important to get kids while they're young, considering career options before they even go into high school, so that when they get to high school, they kind of have in the back of their head, healthcare might be a great track, and we need as many people in healthcare as we can get. So if we can start them young and get them on that path in high school, we feel like there's a good chance they'll go that route in college and beyond. So they're also working on nursing industry education. We have a consortium there. We have a committee that's focused on behavioral health. So they focus on career pathways in behavioral health. Again, huge shortages in behavioral health providers. So that's something they're working on. Career pathways education. So again, getting to students and letting them know what options are out there. And educating and encouraging employee behavioral health support. And we have a panel that'll talk about that later today. And finally, outreach and awareness. So we're always looking to promote the sector partnership itself. We have a monthly newsletter that promotes events in our community, that promotes all the different things that we're doing. We've also started a YouTube channel. This has been going a few years now. And we have all kinds of resources out there. A lot of you have participated, had employees from your organizations talk about a day in the life of somebody in a specific specialty or a specific area of healthcare. So those videos are great for that outreach that we're doing to youth and trying to get them excited about healthcare. So lots of different things we're working on. There's a lot more within each of those committees that they are working on. So if you are interested, we'd love to get you involved. We have 2 QR codes up here. The one on the left is to kind of sign up for a committee or get involved, let us know you want to connect with us. And the other one is just to receive our newsletter. So maybe you just want to start by getting updates from us. Again, this is a monthly newsletter. It's not something that's coming out all the time, and it's really just focused on major happenings in Northern Colorado. So very localized. This isn't national news or anything like that. It's all local. I also want to highlight our next big event. So we have a Nurse Wellbeing Conference on February 2nd, 2023. It will be back here at the ranch, and there will be more information coming soon. So again, if you get on our newsletter, that'll ensure that you get that information. And I'll have that slide up again at the end of the meeting if you missed that QR code. We'll make sure to get you on there. So that's a little bit about the sector partnership. At this time, I would like to introduce our platinum sponsor, let them say a few words. So this year, the platinum sponsor is the Fort Collins Chamber of Commerce. They're a longtime partner, and they're actually the fiscal agent of the health sector partnership. And most importantly today, they're the organization that made this event happen, as I mentioned 11 years ago. The Fort Collins Chamber of Commerce, along with our other regional chambers, are key conveners and initiatives and action that leads to projects and meaningful work to address issues facing our region. We are thankful for all they do in our communities and for helping businesses and organizations in Northern Colorado succeed through a collaborative support system. I'd like to introduce Yvonne Myers with the Fort Collins Chamber of Commerce to say a few words.
The Fort Collins Area Chamber of Commerce is a local association of businesses and organizations that care about the region's future. Your chamber serves as a catalyst for business growth and a champion for a thriving, balanced, diversified, and resilient economy, which enables our community to afford a great quality of life. Join us, the Fort Collins Area Chamber, as we build community.
Woohoo! That was exciting, right? Good morning. I'm so glad you're all here. Some folks said they left early enough this morning. It was 3 below. So congratulations on getting out of your house and getting here and not falling on any ice or anything else. So we're so excited to be a part of this event. It's exciting to be with the Chamber and helping the sector partnership to do this work as well. I have the great pleasure of introducing our speakers, so let's get going, right? Let's get our conference headed this way. So I have the great pleasure of introducing to you our first topic for today, healthcare innovations. Telehealth, AI, robotics, it's not just the future, it's now. This session will share how health systems and providers are incorporating innovative technology in healthcare while improving operational efficiencies. Our speakers are Nikki Caputo and Shawna Hochnadel. We will start with Nikki Caputo's presentation. If Nikki could come to the stage. Nikki is UCHealth Senior Director of Experience and Innovation. She is responsible for leading problem-solving and technology strategy by creating human-centered digital experiences that touch both patients and employees in a way that uniquely connects them. She also serves as a liaison to the UCHealth Care Innovation Center as a subject matter expert for end-user experience. Nikki, take it away.
Sure. Can I take this out of the holder? Or I might break it. I'm really good at breaking technology, which is what we're talking about today. All right. So there was a lot I could pick for 10 minutes to chat with you guys about what we're doing at UCHealth in this space, especially artificial intelligence. I chose conversational AI because it's the perfect example of how technology can help bridge human connection, and that's number one importance to us. Technology can be used as something that distracts us, gets us in a corner, and kind of takes us away from each other. We do the opposite. We look at technology as a way for us to connect with one another. When we can't have a direct human interaction, how do we use technology to actually bridge that gap and make you feel connected? So how many people in this room have used a chatbot? Love it. How many people love chatbots because they help them all the time? Not as many hands. Not one hand? Okay. So I'm going to just go through a few reasons why that is and where we're going and why it will get better and it will help connect you a lot more and get you the answers you need when you actually use them. So the background of conversational AI is artificial intelligence, which is the AI. And a lot of people kind of think of it as this big thing that they don't fully understand. They know it's powered by data, but it powers and it's going to make robots take over the world and, destroy Earth as we know it, which isn't really true, and you'll see why in a second. But there's also pieces like machine learning and natural language processing, terms you've probably heard before. Those are pieces that sit within artificial intelligence. All of it is powered through really good data. It's all powered by really good data. And if you have a bunch of data and it's not connected to anything, none of this is going to work. It takes a ton of human backbone and human work to actually make the data organized in a way for any of this to work. All right. So if you think of AI, this is kind of my simple chart. This helps me. AI is kind of the bigger piece that helps machines do intelligent things. Then you have machine learning, and machine learning is really taking the data and kind of learning from experience and getting better and better and better. Natural language processing is kind of the bigger engine around it. And what that does is take everything I'm saying right now and actually helps computers and software understand what I'm saying. And then what's great about conversational AI or chatbots, it then turns around and allows them to answer back because they understand what you're saying. So you can imagine that's very challenging to do, and it takes a lot of training. So what does that look like? This is actually what it looks like. And so what I mean by it takes a lot of humans and it's not just something processing in the background. Well, I lost it. Oh, this is our number one skill. So most of our patients, when they come to our chatbot, ask to reset their password. On the left there, and it's purposeful that you can't read it, this is a really complex algorithm that our team put together to make sure that your password can get reset. What you see on the front end is just a, hey, I need my password reset, answer a few questions, boom, your password's reset. But because no one just says, I need to reset my password, they say it 100 different ways across thousands of different people. We have to train the bot to understand all of that nuance and actually figure out what path to go to get your password reset. So although that there's all this magic in the science and you see, movies and everyone's interacting with their computers and they're helping them get through their day, right now it's really, really human-based. A lot of work, a lot of programming, but it's getting better and better and better every day. And that's because our data is getting better, we're able to organize it a lot better, and the science, honestly, and the algorithms, they're just ability for us to be able to train and understand and actually have our bot learn has just been awesome. All right, so what about the industry? None of you guys, I don't think one person raised their hand that they love chatbots, but they're not going anywhere. And that's because the technology is getting better. And more businesses are actually investing in them because they know that simple tasks can be accomplished through this technology, and it can actually make every business flow more efficient, like resetting a password or checking your test results, those kinds of things. These technologies are very, very good at doing that. More businesses are seeing it and adopting this technology. I think the biggest thing that's important to mention on this slide is that we're on our phones all the time. And this technology, we're chatting with people, we're talking on social media. This technology perfectly fits within that mobile platform. It's already something we're doing with other people, and so it's a great investment within that mobile strategy. All right, so getting to kind of the guts of who's our chatbot, what do we do, and how does it work? I like to start with what is Livy, because she is a computer software program. We have her on our website. We have her within our electronic medical records. So when you log into your patient portal, she sits within there. We call that authenticated, keeping it very private, very secure. It's behind your login, connected to your data. You can access her through your phone, computer. What does she do? Well, when you're not logged in, she doesn't know anything about you, she's going to pretty much push you over to either create an account, log in, so she can help you more, or she can help you find information. She can help you reset your password and do all the things. But once you're logged in, that's where the magic starts to happen, because that's where we have more data. We have more understanding. She can connect more to you personally and help you out. So she can do things like look at your test results, help you send a message. And we'll get to some of that stuff in a minute. But once you're logged in and you can actually access more information, the more this technology can actually help you. When you're not logged in and you're actually just connected to website data, public data, it's not as efficient. So this is what's really important about conversational AI is we just said, what is Livy? This is important to us as well as who is Livy. And when I started, I talked about human experience and using technology to actually do that. Livy actually has a full personality. She's a CSU graduate. She's always going to be 35 because we figure, why should she age? There's no reason for it, right? But she's a Coloradoan, true and true, and she's not a sports fanatic, but you can ask her if the Nuggets won. Like we had to create a personality to be able to build off. So when you're having a conversation back and forth with her, you feel connected. You don't feel like you're actually talking to a robot. We don't want to do people into thinking she's human. That's not the intent here. The intent here is to actually make sure you feel connected. You feel like we care about you. Because when you can't talk to your nurse or your provider directly, we want to make sure you feel cared for, and that's really important to us, and that's why Livy has such a strong personality. She can't help you, she's going to get you to someone who can. She's there 24/7, which is really important. So we talked about the need for data and how this technology kind of works at a very high level. She's doing the what and the how excellent. The resetting the passwords, the who is my primary care provider. Whoa, connected, boom, this is your primary care provider. Really easy. The simple request around how do I schedule a lab appointment? Real easy to do. It's a nice little flow, easy to program. We have all the data, no problem. Even when you ask her to find a cardiologist, not as simple. You can't just say, yes, go to this person. You have to ask more questions. Where do you want to see this person? And then she'll provide options and ask more questions and go through. Does this really well because there's strong data to support it. All right, what doesn't she do really well? And this is where I talked about natural language processing, understanding what I'm saying. So patients sometimes have complex issues. They have a lot going on, and they'll go into Livy and they'll type a paragraph of information. And it can range from everything, my shoulder's hurting, and I need to message my provider, and I just had some labs done. Livy needs to pull out of that what you're actually trying to ask her, what you're actually intending to say. And that can be very, very challenging, especially we notice more when people use her on the computer. They have a keyboard. They can get really lengthy, and it's very, very challenging. And this is where she has a lot of room to grow. And in any business, any industry with chatbots, this is where they have a lot of room to grow. But the more people ask her and the more they use her, the smarter she gets. A perfect example is on the right side. This is our reset password flow. This is a real example. You can see she's like, yeah, that's just not, what's your first name? And then, can't even read it, but they basically said, yeah, I'm good. And then she's like, well, I'm sorry I didn't get that. Can you try again? And then, yeah, you're not helping me. And then she thinks that's your name because she's trying, right? So this is a perfect example of our team then goes back, looks at this and says, all right, this is not good. This is not good enough. So we go back, fix the data, make some changes, move some stuff around so this doesn't happen again. Not to say this won't happen again, but this exact instance and things around it will not. And this is the continual growth and learning. All right, so where are we headed with this technology? So easy stuff, test results, sending messages to your provider, all awesome. It's the why. So the how and the what, awesome. The why is, why should I do something? Why is an MDPOA important? Patients asking more contextual questions. This is all built around us finding the right operational support, finding the right clinical leaders to help us build these skills with the right data. And we're finding huge success in this area. So MDPOA, perfect example. We got the right clinical support and kind of built out a skill that has a lot of information around the why. Because there's one thing to go fill it out, there's another thing to understand the importance of filling it out, and we want to do both. And this is kind of where we're headed with this, and more of the educational flow for patients. Another one is, and this is going live soon, is our nicotine cessation skill with Livy. So get asking people the questions that you would normally ask if you were calling someone up, like, I really want to quit smoking. A lot of people, they don't want to call and actually talk to someone because they're just unsure about it. They're not sure they want to talk to someone about quitting smoking. They're, however they're feeling about it. But they'll go talk to Livy about it. And Livy can ask them questions, show them videos, give them education. She can say, what did you try before? Oh, did you try toothpicks? Okay. And then if you say, yes, I'm ready, after all this back and forth, which is awesome, once you're ready, she can then pass that information off to a specialist, and they'll give you a call and get something set up. But only if you're ready and only if you say yes. But what's great about it, if I'm that specialist and I'm calling you, I can say, hey, looks like you told Livy that you tried toothpicks. Tell me about that. Increases that human connection, increases that feeling of, wow, I was listened to, I was heard, and now I'm really ready to go. Let's do this. All right, so that's what we're doing right now. Where we're headed, and starting this year and then into the future as the technology gets better, we're really looking at Livy as a way to follow up after your care. You had a procedure, you had something done. Right now we can have people call, check up on you. Livy can do that too. She can do a really good job at it. And if you need help, she will connect you immediately to someone who can help you out. But if you're like, yeah, I'm good. Let's just say you had a colonoscopy. Livy sends you a text. She's like, hey, how you feeling? If you're feeling good, she's like, that's awesome to hear. Hey, if you're hungry, here's some restaurants nearby if you want to pick something up on your way home. Like, she's really good because it's all driven by data, because we can connect all of that to it. And again, if you say you're not doing so hot, she has the resources to then connect you to someone to talk to immediately, because she's not there to offer medical advice or help you in that way, but she's there to connect you to someone who can help you. Another really cool thing we're excited about is video visits are now, they're not going anywhere. They're commonplace. People actually really like them. Can be challenging. There's technology issues. We need staff to ask you questions sometimes before you see your provider. Livy can do that too. So instead of someone from the clinic having to call you and ask you questions before you see your provider on your computer, Livy can ask you those questions, and then your provider sees them once you interact with them on the video. That frees up clinical staff time, makes things more efficient for you. Livy can go in, make sure your microphone's working, making sure your camera works. This is where this technology is going, and it creates more efficiency because it's done through autonomous chatbot versus a live human, freeing up that human to do more important things, creating that human connection. And one thing I like to mention, because it's really important to us to keep you healthy and well and out of our facilities, is Livy also is going to have a bunch of new wellness skills. And so another really great use of this technology for anyone who wants to adopt it is to put in skills that just are fun and interactive and make you feel good. And so we've partnered with a couple companies to get meditation support. So Livy can connect you to meditation resources. We all need to take a few moments every day to breathe and to really reset ourselves. And using this technology to do that could be really powerful. So we're excited about that as well. All right, so, can I pause it? Do I go back? All right, cool, thank you. All right, so I talked a lot about chatbots, conversational AI, and where we're going and what it can be done. Hopefully, it helps spur some ideas in your minds. I'm switching technologies really quick to end this. And I'm gonna play this, and it's just an unedited clip, and then I'll speak to why I'm playing it.
There he is.
Hey, Gabriel.
What's going on,
How's
man?
it going, man?
Hey,
Nice
good
to meet you. Heck yeah.
Look at you. Look at that.
Anyone know where they're at?
Oh, there's the Capitol building. Okay.
Yeah. Oh, yeah. Somebody caught a beer. See that?
No, I missed it. Oh, on the fire truck?
Yeah.
Dang it.
We crossed Beer and then we came down here and turned on Wine Coop. And when you started seeing Union Station,
Yeah, that is freaking cool.
that was trippy. That was cool. Appreciate you, buddy.
Congratulations again on the win.
Thanks, bud.
We'll do it again this year, huh?
Absolutely.
do
Let's
back
get
to
started
back.
tomorrow.
All right, short, simple, sweet clip to show technology brings people together. There's no greater technology than virtual reality to do that. This was a shared experience between Gabe Landeskog and one of our patients who is a huge Avs fan. We actually had filmed the parade, the Stanley Cup parade, in 360 to allow our patients to be there. You really feel like you're there. And Gabe was nice enough to actually put the headset on with this patient, and they spent 8 straight minutes with those headsets on, just chatting back and forth and connecting, and Gabe reminiscing about the parade and chatting with the patient. And it was one of the most awesome experiences to witness, because they have these headsets on, they can't see one another, but they're connecting through voice and through a shared experience. And that's the power of technology and where we want to go. So I'll end with that today. Thank you.
Wow. I didn't know it's called a chat bot. I just learned that myself. And I was reminiscing yesterday, I had to make a follow-up appointment, and they said, do it, I have to have a procedure. And they said, follow up 7 to 10 days. Well, my doctor's not available in 10 days, but like 20 days. So then there's a chat box where you can write in there your question, and it said you only have 45 characters. I thought, oh, you don't know me. So I typed, and I got to 162, and then when I pushed send, they said, you only get 45. I was like, shoot. And it did work, and I sent it, and in about 20 minutes, they came back and said, make it for January 10th when your doctor's back. And I said, thank you. And it all just happened, and I could continue work, and they could work, and it works. So thank you, Nikki. I think we all think chat bots are an awesome thing. We're all going to leave here and talk about it with our families tonight, so thank you. Next up, and there you are, yay, Shawna Hochnadel, right? I'm saying that correctly. Shawna has over 20 years of clinical experience, including the past 9 in the Informatics specialty at Banner Health. Prior to working in informatics, Shawna was a nursing leader and preoperative, obstetric, invasive procedure, and clinical laboratory experience for rural and large health systems. My goodness. As a nursing informatics program director at Banner Health, Shawna collaborates on strategic initiative development as well as optimization and integration of technology supporting patients and clinicians across the continuum of care. Welcome, Shawna, to share with what Banner is doing.
Can you hear me? No. Oh, I got to get closer. Is that better? All right. Yes, my name's Shawna Hochnadel, and today I'm going to share with you some clinical innovations that Banner Health is focusing on right now to support our workforce. So we're going to take a little different trip than we did on our previous speaker. So COVID-19 wasn't good to us. I think we can all agree with that. In our workforce is, I think, center of mind to that. In these pictures, these are pictures of our workforce, the faces of our workforce, what they went through during the pandemic. And at the center, that's our patient, Sophia. And we are heading into a pretty exciting flu season, it seems like. This year's flu season has had an early activity for respiratory illness. Right now, numbers are looking like the numbers you'd normally see in January or February, according to recent CDC reports. So with an early flu season, that typically means that the population is more susceptible to flu. And many experts believe that the cold, the flu, and COVID-19 are all gonna join a band together and peak at the same time, which will be great, right? So the thought is it's gonna overwhelm our healthcare systems and our workforce once again. We know that COVID-19 had a significant impact on care at the bedside. There were so many shortages of staff, shortages of supplies, shortages of space. I remember having to keep the N95 mask in a little paper baggie with your name on it and reusing it day after day. Nurses are now leaving the profession at an alarming rate. As you can see, 1/3 of nurses plan to leave within a year. There are many factors that are contributing to the nurses leaving. So increase in patient volume, higher occupancy rates, they lead to severe emotional and physical exhaustion, and ultimately job satisfaction and burnout. Our workforce was decimated from COVID-19. Many clinicians experienced anxiety, depression, insomnia. And the healthcare workers that are left are leaving. As you can see, the nursing shortage is expected to exceed 2 million by 2025. The patients are suffering from this. And who's going to be left to take care of the patients if we don't take action? Banner Health is taking action by looking to clinical technology and innovation strategies to support our workforce at the bedside. We're focusing on these areas right now: workflow automation, so looking to automate decision-making and simplify workflows for clinicians; nursing decision support using predictive analytics to guide clinical decisions; leveraging technology so we can eliminate unnecessary physical movements and improve that care delivery, making things more efficient. And then lastly, eliminating documentation burden. So as our electronic health records have become more robust, so is the documentation. We keep adding and we keep adding, and we don't take anything away, it seems. So those are the areas we're focusing on. One great innovation example we just completed was a pilot where at Banner worked with our hospitalist and assisted documentation. So we partnered with a tech company to integrate directly with our EHR, which is Cerner, for a seamless workflow. We had a link embedded in Cerner, and the software analyzed and synthesized the data to recommend diagnoses, automate note-taking, and capturing missed revenue. The hospitalists could proofread, edit, save the notes, and this all included their outcome diagnoses. So this allowed our hospitalists to practice medicine, not documentation. You can see from the outcomes of these short 60, 90-day pilots, we had really positive outcomes, and we're looking forward to continue this. This picture is Andrea. She's an ICU nurse at a Banner facility. She's caring for a very sick patient. Nurses like Andrea and patients like this exist in every hospital. Every one of the devices in this picture are providing crucial treatment to the patient. Respiratory, helping them breathe, filtering kidneys, administering intravenous medications, preventing pressure injuries. Andrea is responsible for monitoring, adjusting, and documenting all of these machines' inputs and outputs. Our current process is a manual process for this. So that means Andrea has to complete this documentation when she has a moment to spare, which isn't very often. And you can see by that glove that Andrea, like many other nurses, will write their vital signs on gloves, on scrub pants, on tape, on windows, wherever they can, so then they can remember those when they have a moment to spare and document them. How big is this problem? The statistic nationally accepted is that nurses spend 25 to 30% of their day on charting. Our own data with Banner also supports this fact. A patient as sick as this one that Andrea is caring for, on every assistive device in our arsenal, will spend 229 minutes or 4.9 hours per day just entering numbers. Our vision is for Andrea and other nurses like her to dedicate that 2 to 5 hours to providing world-class care. Every device that can heal the patient can be integrated. So Banner is making an intentional focus on reducing and improving this nursing workload. Our primary efforts are focused around medical device integration. We are looking to leverage the electronic health record and automate all medical devices to allow the data and information to flow freely back and forth, eliminating this current manual process of data entry, and instead allow the nurses to focus on our patient or Sophia. Another goal Banner has is to put virtual nursing into our patient care areas to augment the bedside nurses. Virtual nursing, simply put, is just delivery of care from a remote location. Virtual nurses can monitor patients, collaborate with nurses, physicians, therapists, and other clinicians who provide care at the bedside. Virtual nurses can pull up the chart, they can talk to the patient in the room. Many tasks performed by nurses on an inpatient unit are repetitive. A virtual nurse unit allows these virtual nurses to manage these tasks remotely, such as coordinating procedures, reconciling medication, getting sign-off from multiple care team members, providing patient education, answering patient questions, and initiating the discharge process. This will then free up our bedside nurses and staff to focus on patient-facing care, while those in the virtual unit can monitor the patients and enter data into the medical record as needed. Virtual nursing has been shown to reduce administrative burden on nurses, as well as improve the engagement and satisfaction of nurses. The goal is to provide a new level of support to patient, nurses, and the bedside team. Documentation burden is another huge area of focus for Banner. Inpatient and outpatient documentation has been shown to impact clinician well-being. This includes documenting the actual data into the medical record, as well as reviewing documents in the medical record. Both are very time-consuming. The burden of documentation requirements for clinicians has led to a variety of challenges in the workforce, including extending the hours of work, time constraints, increased professional workload, and disruption to the patient-clinician experience because we're too busy staring at our computer and not actually talking with our patient. This phenomenon has resulted in an observed increase in medical errors, negative impacts on patient safety, and high rates of turnover and clinician burnout. This is for both our nurses, our physicians, any role that's documenting in that chart, it's a big dissatisfier. This is a really exciting thing that I'm glad that we're working on at Banner now, and to help with this documentation burden, we're looking to new technology innovation, which is voice-enabled charting for nurses. Physicians have had this technology for several years. Nursing documentation is historically very structured, so it's a good fit for voice-enabled charting. And Banner's actually getting a demo later today from one of our tech partners for voice-enabled charting for nurses. The idea is to reduce the documentation time by generating accurate nursing documentation with fewer edits, clicks, mouse moving, while integrating directly with our electronic health record. The goal is to give nurses more time for patient care and to improve the quality of documentation. We just need to move to new and innovative models of documentation to improve job satisfaction, engagement, and reduce nursing burnout. We need to let the nurses focus on what matters, our patient, Sophia. If you have any questions for me, please feel free to send me an email. But I appreciate your time, and I hope you guys have a great rest of the summit. I don't want to take your stuff. Okay, there you go.
Thank you, Shawna. That was so interesting as well. I think sometimes we forget and we get inspired by this event to realize how awesome and amazing healthcare is in northern Colorado. Back in September, I was in Du Bois, Wyoming on my way to the Washington State CSU game. Yes, I'm that fan. I know we're going to lose, and I still went to the game. Go Rams. And I woke up with a pain on my side, and I thought, my God, I'm having a damn heart attack, and I'm in Du Bois, Wyoming. How quickly can I get back here to Fort Collins where I'm going to have great health care? So I hope one of the takeaways from this AI conversation is that you get reinforced and re-energized around how amazing healthcare is in northern Colorado. Sometimes we forget because we're all just about the shortages and the issues, but we really do have innovative, forward-thinking, both of our organizations here. So let's give them both a round of applause for all their efforts. All right. I guess now I'm bringing up to the stage our gold sponsor, Anthem Blue Cross Blue Shield, to the stage.
Protecting your health is important, and so is protecting your budget. Anthem can help you protect both, with plan options starting as low as $0, and most people qualify for financial help to lower their costs. We'll help you find affordable care when you need it, with no-cost preventive care, $0 commonly prescribed drugs, and $0 virtual care visits, so you can feel confident you're covered.
All right. Thank you, Yvonne, and good morning to the attendees of the Health Summit here in person at the ranch and online via the live broadcast. Anthem is proud to have served Colorado for the last 83 years. In Colorado, there are more than 793,000 Anthem members. Nationwide, there are more than 1.7 million doctors and hospitals that are contracted with Blue Cross Blue Shield companies, which is more than any other insurer. Anthem is committed to Colorado and the members that we serve. The annual open enrollment period for individual health plans is going on right now through December 15th for January 1st effective dates. Individuals that experience certain qualifying events, such as involuntary loss of coverage, may also experience a special enrollment period throughout the year. The next topic for today is the future of healthcare workforce building the pipeline. This session highlights ways to engage your future workforce early and ensure you have the workers you need. I'd like to introduce the moderator for this session, Evan Hyatt. Evan is the Director of Marketing and Communications for Care Synergy. Care Synergy is a not-for-profit organization that supports an affiliation of hospice, palliative, and home health care providers along the Front Range of Colorado. Evan also serves as co-chair for the leadership team of Northern Colorado Health Sector Partnership.
Thank you, Jenna. Good morning, everyone. If I could have the panelists that are going to be part of this come on up, that would be great. Thank you all for coming. We're very excited to be putting on this conference today and hope for presenting things of value. I think this next presentation and our moderators, our experts, will be providing some valuable information and on their experience. And so the way we're going to do this, I'm going to ask some questions of each of our moderator to share some things with you. As we're running a little behind, we probably won't have time for questions at the end, but they'll all be around during the conference. So if you have a particular question for each one of them, maybe seek them out, and I'm sure they'll be happy to answer what you might have. So first, Stefanie Merrell, who's here with us today, she's going to speak to some things related, as you can see, to K through 12 work-based learning and her role as a business liaison. So Stefanie, one of the first questions I had was, could you explain your role as it relates to K through 12 work-based learning and your focus with the school districts and connecting them to business?
Sure, thank you. Can everyone hear me okay? Okay, very good. The light is very bright, so if I look like I have something in my eye, that's why. Of course, work-based learning is providing the opportunity for students to have the classroom experience, but also experience in the workforce for their career pathway. I'm the K through 12 business liaison, and I work alongside Poudre School District, Thompson School District, Estes Park School District, and also Colorado Early College, Fort Collins. So all of these school districts actually utilize a shared platform called Xello, Xello. How many of you have heard of Xello? Very good, a handful of you. So my job is actually to sit with the businesses and explain work-based learning to the businesses and meet them where they are in their work-based learning journey. So what I can do is, if you're already in Zello, already a champion of work-based learning, we can provide more opportunities through that platform. Or if you are new to Zello, I can explain what it is and, again, meet you where you are in your need. My role is actually funded through a workforce innovation grant that was received by the Fort Collins Area Chamber. And like I said, I work alongside those school districts. At those school districts, there's work-based learning coordinators, and they're working directly with the students on their career pathway. Those students, as early as middle school, utilize this Zello platform to already start their career exploration. And healthcare is their number one career pathway for a lot of those students. So we're looking to build up that Zello platform so that when students are exploring their careers, they actually can see the businesses, the industry there to connect themselves to the opportunities.
Great. Thank you, Stefanie. I think we can all agree there's numerous benefits when we talk about work-based learning. Maybe could you speak to some of the more direct benefits to our employers, and then what would be their next steps? How do they get involved?
Yeah, absolutely. Great question. So benefits, we can all agree that there's a number of benefits to the students, right? If they're already saying that they have a career pathway and they can get into your industry, into healthcare, to explore whether or not they're actually wanting to pursue that career, that's huge. Once they get into your doors and they see that they want to be a part of your environment and your ecosystem, that's also huge. So what we're talking about is a captured audience of high school students that exist out there. Like I said, I represent Poudre, Thompson, Colorado Early College, and Estes Park. So we have access to over 13,000 high school students ready to see your business out there and connect to work-based learning. So I would say a benefit to businesses for my work specifically is the fact that you have this captured audience. And also just being an industry leader. If you are providing work-based learning and that work-based learning is working for you, you're bringing in these high school students and you have access to this career pipeline, others will look to you as a champion in the industry.
Great. And Stefanie, you're available to actually go out and meet with businesses and show them how this works. Could you talk a little bit about how to get connected with you and if folks are interested?
Correct. So that next step, as you asked about, Evan, is really simple. So you can connect with me. I will be here at the summit all day. I have a booth. I'm just representing the chamber over here, and I have business cards and an area to sign up. So Zello is not a platform that you can actually just log on and connect to yourself, but that's what my job is. Again, sitting with businesses, talking about work-based learning needs, and connecting you to the students, those 13,000 high school students that we want to bring into our industry.
Great. Thank you, Stefanie. One valuable takeaway, so write that down, and if you want, connect with Stefanie and she'll get you started. Our next speaker or presenter is Andy Yost. Andy is the Work-Based Learning Navigator with Employment Services of Weld County. And Andy, if you want to do a brief introduction with this first question of what that means, what you do. But maybe you could just tell us about what workforce programs are currently available that can connect new talent and entry-level positions in healthcare.
So I work for Employment Services Weld County in Greeley. I'm a work-based learning navigator, and basically we try to connect businesses with the grant funding that were provided for internship programs, apprenticeship programs. So what I really want to talk today about is a couple of our programs that we can utilize. And I want you to think about your training programs or your internship programs, or maybe you would love to start an internship program, but you just have not, the funding might be tight, the resources might be tight to do that. One of our programs is a work experience program. For this situation, the county actually hires the employee. We pay the workers' comp. They're Weld County's employee. They go and work at a work site to gain work experience. Our hope, obviously, is that they become, a great employee for you, and after that work experience session is done, you want to hire them as a full-time employee. Our goal is obviously to get them into the workforce. An example of that, we currently work with Banner Health with their EMT, and actually through Ames Community College. When they are done with that EMT program, they can be hired through Banner. They're technically, I guess, hired through Weld County, but they then learn how to become an EMT on the job. That's a situation where the employer, it's up to 500 hours for this work experience program. We will pay minimum wage or up to 80% of the typical salary for that position because it is in a training situation. So that might be an option for some. The second program that we offer might work well with apprenticeships, and it's an on-the-job training program. In this situation, the person is actually hired by the organization, but to offset the cost of their training period, we will reimburse that organization back 50%, up to 50% of their salary for that training period. So this might work well for an apprenticeship, because apprenticeship, you're looking at hiring somebody for a long-term situation. While they're earning that wage, we can actually help supplement that wage period. So those are a couple programs. Hopefully, if you can think about your training situation and how that might be able to be utilized, connect with your workforce center. Obviously I'm Weld County, but other workforce centers in other counties offer very similar services.
Great, Andy, those are great things. Maybe, it made me curious, you talked about these programs available. Maybe speak a little bit to what is required by employers to take part in these programs.
Yeah, the work experience is a pretty simple process. There's a short form that you complete. They actually have to get approved through our human resources at Weld County. Because they're going to be a Weld County employee, they want to make sure safety is not an issue. There are some limitations with that program, just so that you're aware of. Typically, they can't work a full-time, wage unless if they have insurance through somebody else or Medicaid, they're able to work full-time. Other than that, they do kind of cut that at 29 hours a week, so they're not considered a full-time employee. There's also certain fields like driving. They limit the fact that they could be in a driving situation, so it does kind of depend there. The on-the-job training, again, very simple form to start the process. Most of that paperwork is actually done through the job seeker side. One other thing I guess I do want to bring out, the job seeker, the money does follow the job seeker for these situations, so they do have to qualify. The qualifications change periodically. I haven't been in this position too long, but the one thing I have learned is that the funding situation changes continually. And so, during times of COVID, it was a little, looser than it is now. But it changes constantly. So
great. Thank you, David. Thank you very much. Again, if you have particular questions for David, I'm sure he'll be around. You can ask him. We're so lucky to have these great workforce centers, both in Weld and Larimer County, providing this kind of support. Please don't hesitate to reach out to Andy or Stefanie with questions about how to get connected. So our next speaker is David Cessna. David is a career guidance counselor at university schools and board vice president of the Centennial Area Health Education Center. And David, if you want to add anything to that, please do. But our first question for David is, in talking about this, I think it relates to probably many schools, but could you talk about what experiential learning looks like at university schools?
Sure, thank you very much. I'm pleased to be here. I feel like I got the best job in the world. I did about 30 years of this with higher education, career development, and experiential education programs. So I was doing a bit of substituting at university schools, seeing that they had these requirements. So I was asking students, so what are you doing for your internship? I don't have a clue. No guidance whatsoever for high school kids. I did this in higher ed. I can tell you college students struggled with this as well. So they were looking at this as the requirements of 3 half-day shadowing experiences. Have to do this before graduation. Also a 50-hour internship. So what they were doing, I'm going with Aunt so-and-so, Uncle so-and-so, going to work with my dad. And so I talked to school about developing something that had some value and real meaning to it for students to help them create their futures. So I'm about 3 years old in this, and I was lucky enough to catch it during COVID. But so that's pretty much what I am doing, is helping students navigate this whole process at this point. And do you want me to go on and talk about?
Well, could you talk about, the connection maybe more specifically with Ames?
Yep. So one of the, and particularly during COVID, was great. As you know, I could not get our students interested in health careers into many health organizations. So thank goodness Ames was there, to be honest with you. So we sent a good number of our students interested in health careers to Ames for their shadowing experiences. So things they haven't considered, they usually look at this, I'm going to be a doctor or a nurse. A few of them can go beyond that, but so we'll get them involved with some hands-on classes, radiation technology being one, where they get to go in, actually see equipment, listen to the instruction. I don't just send them into classes where people lecture, but where they get to see some hands-on types of things. Surgical technology, sterile processing. In nursing school, gets them into the mannequin labs, one for the first-year students, one for the second-year students. So they actually get to participate in some of these classes, get some ideas beyond what they're thinking as doctors or nurses, and the value of it. Some come back very excited, some come back saying, this is not going to be for me, which is great information. Many of our students go on to the career college with the med prep program, so they can do a year of the high school, half days, taking college courses. Many of them end up with most of them with their CNAs, many with their EMTs by the time they graduate from high school. A big leg up when they're applying for any health career. More experience, the better.
Great. And I think we've got just enough time, maybe, David, quickly to talk about the HOPE program within CAHEC. Could you talk a little bit about that?
So another great program for any of your students out here is the HOPE program, health occupations, promoting equity. It's put on by the AHEC, Area Health Education Center at Anschutz. We're operating that in this region through Centennial Area Health Education Center. It's a series of 6 programs, about 2 hours each. They meet once a month and go through various topics. The first one in November was on fentanyl. They're going to be doing one on native cultures, one on oral health, so various topics related to health. Students who attend these are eligible for consideration to go to summer camp, either at CU Boulder for a week, all expense paid, or to University of Colorado at Colorado Springs at their medical school. And it's for an entire week where they're immersed in health programs. They go to Anschutz 3 days of that time, talking to department heads, many panels of students in various occupations. So they really get exposed to a broad range of things beyond becoming a nurse or a physician. So
great.
Very pleased for those programs, and like I say, I love my job. It's the best one ever.
Thank you, David. Yep. Thank you very much for your leadership in Northern Colorado with our youth. That's great. And to wrap up this part of our presentation, Nick Peterson is going to share some information with us. Nick is the Community and Business Development Coordinator with Poudre School District. Thank you, Nick, for being here. And I think we talked about, this is such a dynamic time in education, and maybe you could share what insights about education, particularly in high school, can you share as it relates to our topics today?
Great, thank you. I love my job too. So just wanted to put that out there. I feel like I have to say that. In education, I've been in education pretty much my whole adult life. I started as a teacher, a high school band director, and then I was a high school counselor for 13 years, and now I'm in this really cool job where I get to address some of the problems that I complained about when I was a high school counselor. Like, why aren't there opportunities for this? So it's super fun to have a bigger picture perspective and to get to kind of work with the world outside of education to try and bring about solutions for the benefit of our students and community. I would say in one word, the state of education is probably similar to that of healthcare, and that would be strained. We have a lot of growing needs. Some quick hits on some of our data here. The numbers of students with special plans like 504 plans or IEPs or that are doing English language learning, all those numbers are increasing rapidly. When you look in a typical classroom, people on those special plans represent like a third to even a half of a typical classroom. So those teachers are really strained trying to meet the needs of all their students right now. So when you hear about that burnout that's happening in healthcare, a lot of that's also paralleling in the world of education. An interesting thing that we're looking at too, both in high school and in college, is that youth employment is at an all-time low. So despite the labor shortage, only about 1/3 of high school and college students have a real job by the time they're ready to enter the workforce. So our aim is to try and change that and to try and meet that deficit. We have increasing mental health needs as well. 30%, we have a connections survey, by the way, in our Poudre school district, and 30% of our students are identifying as not straight. We also have a large number of students that are saying they're not connected to their peers or connected to adults. So I kind of bring all this up because despite our stats of higher graduation rates and some things that look really good, we also have some really concerning things that we're trying to address underneath that to support our community. So we can celebrate the good things. Our grad rates are going in the right direction, but we have a lot of at-risk populations and a lot of need. So I bring all that up because work-based learning, our data also shows us when kids are engaged, their data is better. Their connections reports are better. Their engagement in school, their acquisition of credits, their literacy scores all go up. And so I would love to have conversations with all of you, either here in person or you can find me on the Poudre School District website later and send me an email. But we're really trying to build out our infrastructure around work-based learning because it really is that tangible solution that addresses a lot of these trends.
Great. Thank you, Nick. And I don't want to fail to mention that we appreciate the work that Nick does. He's our Get Into the Guts chair, which Jonah mentioned earlier, which is a very successful program of getting even middle school age kids, even younger, involved in seeing in a real world experience what healthcare careers can look like. So thank you, Nick, for organizing that. I think we're going to wrap up. Thank you to our panelists. And again, if you have questions, I apologize we didn't have time for questions, but they'll be around. If you have something specific about work-based learning, how to get youth involved, these are the folks to talk to. So thank you all very much. I'd like to welcome Jonas McKinley back to the stage. Jonas is going to keep us on track and get us going. So Jonas, take on.
All right, guys, it's that time. Nobody's been talking about COVID, right, for the past couple of years. Nobody's sick of talking about it. You guys were really hoping there'd be an agenda item on COVID today. No nodding heads, so weird. We struggled with this. We felt like we needed to address it. We wanted to have a provocative agenda item on here to drive attendance to this event, something about the end of COVID, COVID is over, celebration, something like that. But for those of us in healthcare, we know that's not necessarily the reality. So we pivoted. I think we have a really good program today. So what we called it was, Are We There Yet? So for those of you that are parents like me, hopefully you've heard that, or maybe when you were a kid you used that in the back seat. So are we there yet? COVID workforce and crisis management adjustments. So the COVID-19 pandemic caused many shifts to systems, processes, and decision-making. Our session today is going to highlight some of the major changes in workforce and staffing we saw in Colorado and in healthcare, as well as feature how organizations are changing their strategies to be prepared for future outbreaks and pandemics. And again, most of us, as we established early on today, are in healthcare, so maybe you'll pick up some ideas or things you can take back to your organization. So first speaker I'd like to welcome is from Colorado Workforce Development Council, or CWDC. They partner with the Health Sector Partnership on a major basis. They've been a supporter from the beginning and financially in a major way. So we have today Thomas Hartman. Please welcome him to the stage.
Good morning. Can everybody hear me? All right. My partner, Caitlin McKinney, Dr. McKinney, was unable to join us today. She decided she had a little strep throat after getting swabbed. So I'm going to do my best to share the information. She is an economist. She's in a shared position with the Colorado Workforce Development Council and the Department of Higher Education. And so a lot of these slides she developed and presented. Fortunately, I talked through many of these with her. So if you'll forgive me, I'm going to stick to a script for the most part. And Nikki has asked me to be brief and to be thorough. And so I'll give you some resources at the end and things you can do to get more information. So thank you so much for your attention. I think, was there a clicker or are you going to do slides for me? He's pointing. It's on the computer. I just have to see through my screen. All right. Okay. Is that in black and white, or does it look like it has any color? Interesting. Okay. Well, the figure on this slide displays top hires by industry. These numbers reflect the amount of people choosing to relocate to Colorado for a job. The top 3 industries attracting talent from other states include retail, accommodation and food service, and healthcare and social assistance. These are linked to the top hires to the state and reflect high need, high demand industries for Colorado. By providing jobs to workers, employers have the ability to bolster talent flows both within the state and as well as into the state. The figure on this slide, I'm going to do 2 machines at once. This visualization is the talent pipeline report this year, and it shows the top 10 industries statewide in high need. And this was created using 2-digit and 6-digit NAICS industry codes. So the number of top jobs data is sourced from the Bureau of Labor Statistics, and all other inputs sourced from Lightcast's economic modeling platform. To create this, we generated 2 new variables, and the measurement reflects occupation demand in Colorado, and we call them the effort index and gap intensity. The effort index reports how many times an employer has to post a job in order to fill the position, providing a quick way to view which jobs employers are having to post multiple times to hire in order to grasp an industry's overall hiring challenge. Thus, the higher the index number, the more difficult it is for employers to find talent in a role, to fill a role. The gap intensity indicator was created to account for how many jobs are needed overall in each industry. The gap industry modifies the index, the effort index, based on a ratio between the total number of jobs and the unique postings in an industry. If there are a lot of postings in a particular industry, for example, the gap intensity will be greater. If the industry only has a few postings compared to the number of existing jobs, the gap intensity will be lower. So in other words, the gap intensity is the measure of the relative magnitude of the total hiring challenge. Here we can see this tool as sort of a heat map, and it shows the hiring challenges for Larimer County. And again, I know you can't read all of those details, but this shows that direct care and long-term care really stand out. And those are the numbers with the higher bars. For Weld County specifically, nursing care facilities, long-term care, and direct care are amongst the top high-demand, high-need occupations. Here we see the overall employment situation for healthcare workers at a statewide level. The blue bars indicate average monthly postings, while the red bars represent average monthly hires. Between August 2021 and August 2022, registered nurses saw the highest monthly postings, indicating major employer demand, while home health and personal care aides experienced the most hires during this time frame. The pie chart on this slide displays the top hiring healthcare facilities in Colorado between August 2021 and August 2022. UCHealth took the lion's share in respect to talent found, accounting for 44.6% of the top 10 hiring facilities in the state. To reflect on how healthcare has bounced back from the pandemic, this slide compares major subsector employment in healthcare services during February, comparing February 2022 and February 2020. These percentages are a ratio of employment levels between this allows us to better understand the job loss and the job recovery in health services since the pandemic. Ambulatory services and hospitals have fully rebounded and surpassed their pre-pandemic levels by a slight uptick. And residential, however, nursing and residential care facilities, as well as social assistance linked to healthcare services, have not reached the employment levels that they had at the onstart of the pandemic. The Colorado LMI Gateway is a place where you can see some of this data in more real time, and I'll have all the links and everything included in the slide deck. So this is the same information as you saw on the last slide, but it compares the contrast other large industrial subsectors within the state. Industries with the blue highlight around the name indicate February 2022 employment levels exceed their associated pre-pandemic level. Ambulatory healthcare services and hospitals are one of the 4 subsector industries that have surpassed their pre-pandemic levels in terms of employment. Here we see the adjusted annual salary trends month by month for healthcare jobs in Colorado between August 2021 and August 2022. These wage levels are only associated with the more hands-on healthcare occupations, so they exclude the administrative jobs. December 2021 saw a surge in advertised wages, indicating a high employer demand. This seems to be the largest outlier during this time frame, with the rest of the wage levels following a similar trend, ranging from $60,000 per year to roughly $70,000 annually. This slide reports the top 10 qualifications Colorado healthcare job seekers indicate they have obtained on their online profiles. This allows employers to understand the talent pool in the state. Basic life support certification far exceeds all the others, and there's roughly 75,000 job seeker applications looking to fill positions in healthcare that already have this credential. Again, a lot of this stuff is really just tip of the iceberg, so I'm giving you the highlights, and if you're interested any more in these in detail, we'll let you know where to find those resources. All right, this has to do with the experience levels that employers are seeking, and they're basically looking at most employers are not necessarily looking for a minimum experience, or they don't list a minimum experience on some of their job postings, but most of them do indicate they're looking for a few months to 3 years. So quickly, a couple of resources we have available. First of all, Colorado Workforce Development Council. We are a governor-appointed public-private partnership. And we work towards enhancing and sustaining skills-based talent development networks that meet the needs of employers, workers, job seekers, and learners for today and tomorrow. So CWC leverages several strategies, career pathways, sector partnerships, work-based learning, all of these things to enhance, sustain a skills-based talent development network. CWDC strives to increase awareness of the talent development network so more individuals and businesses can utilize available resources and can access useful and actionable information about employment, education, training, and all of this is available mostly through our website, and you can see some of the resources I have shown here. A couple of highlights that I'd like to point out. We have things like My Colorado Journey. Anybody heard of My Colorado Journey so far in the room? Please raise your hand. Excellent, thank you very much. That's supposed to be an online resource, kind of a career counselor in a box, so related to a lot of the things that you all work with, but really this is on the talent development side. We also have things like a talent equity agenda, so increasing equity, diversity, and inclusion in our workforce. We have a new sector or department within our council, and that's dealing with talent finance. So looking for creative ways to help talent finance their education and move through and obtain employment in Colorado. I kind of want to finish off here with job quality. We also have a job quality framework, and really attracting and growing good jobs in Colorado is kind of key to a strong economy and creating opportunities for all Coloradans. So we produced this quality job framework to outline features of a good job and lay out practical steps for local communities, employers, and leaders to take and improve the job quality in Colorado. And I'm going to do one more quick shout out here. Related to job quality, I recently learned about engagement and its relationship to turnover. This information was given to me, and I'll share it with you, by Tom Williams. Tom's raising his hand over here. I encourage you to talk to Tom more about this information, but here's kind of the key takeaways that I learned. Employee engagement and turnover is a significant challenge in healthcare. Hospitals turnover in Colorado, about 29% is the turnover rate. Not only does this result in nursing burnout, but it creates substantial financial impact as well. U.S. healthcare organizations view retention as a key strategic imperative. By developing engagement and turnover strategies with measurable goals, healthcare organizations can reduce burnout. And with that, I'll wrap up. Hopefully I did enough time, not too fast, not too slow, but please reach out and contact us or get in touch with our Colorado Workforce Development Council. You can get on our mailing list, and you can also find that at cwdc.colorado.gov. Thank you for your time today. I appreciate you all.
All right, thank you very much. So again, as a reminder, all these slides are going to be available after the fact, so no need to screenshot them with your phone or anything like that. And a reminder that on your table is the QR code that links you to the program with all those presentations and everything you need. So with that, we'll get to our next speaker. It's going to be Dr. Angela Mills from Banner Health. If you wouldn't mind welcoming her to the stage, she has a brief presentation for us.
Good morning. All right, today I'm here to talk about COVID, workforce changes, and future strategy. This slide is a slide that is very important to me. This is Northern Colorado, so this is us 3 banner facilities: North Colorado Medical Center in Greeley, McKee Medical Center in Fort Collins, Banner Fort Collins Medical Center. And this is COVID positive patients from the end of March 2020 to then it goes through like the cusp of 2022. History is important, and I think understanding this graphic is really important when it comes to workforce. There are dates that I will never forget, and as they repeat themselves, it's interesting, the anniversary of things. The weekend of March 6th, 7th, and 8th, 2020. No one in this, well, I won't say no one, but we did not have the first positive case yet by laboratory, but by CT imaging and clinical history, we knew that it was in our hospitals in Fort Collins. And Banner Fort Collins within the Banner system was the first COVID patient. The alpha strain, which is the first 2 peaks that you see, in healthcare administration, when you are going and climbing that peak, the tension and the strain is so high on the workforce that's in there, and many of you are aware of this. But I'll tell you other dates we remember. For me, December 18th, 2020 is the top of that second peak that you see there, the large one, because you wait and hope that we've peaked, so we're coming down, so that the resources and that we can recover. And you wait every day, you go to bed and hope that the next day you're not we didn't go up again. The most important dates for me on this graph that produce a moment of pause for anniversary is the week of August 20th through August 27th of 2021. And that as an administrator, because the towns, people are going to school. I'm taking my kids to school. We're all back in school again. We're not doing virtual. We have a mix of masks or no masks. Do we need to isolate? And what we saw is that trajectory from August 20th to in 4 days, we increased our patient load of COVID by at least 10 every 24 hours. And when you experience that as physicians, as nurses, as ED, as ICU, as the hospital, it is so much and so much work and communication to understand how we're going to quickly take care of that many patients that fast. And we didn't even know what was coming, and that was all Delta. So the second part is all Delta, and the area under that curve and the workforce in 2021, after experiencing the unknowns and the being the heroes kind of getting through those first 2 peaks, and then being in 2021 and experiencing what we did, I think it is so important to pause at this graph and realize what so many people in this Northern Colorado region have done for the community to keep our patients healthy, safe, and cared for. Our number 1 mission at Banner Health, well, we had 2 things with COVID. Is one, we're going to save as many lives as we possibly can, and we're going to keep our workforce healthy and safe. And that was the communication. That was the message. Our response, this is a very limited list, but we were in incident command every day, working 7 days a week. I know many of you, this is redundant. You've lived this, you've experienced this. But communication had to be a top priority because of how many patients we were taking care of. Redeployment, upskilling of staff still continues today. The daily communication I've mentioned, PPE updates and acquisition, making sure we're taking care of our workforce and that they feel safe in the environment that they're working. Ventilator utilization, if you think back to that graph and that area under the curve, we need oxygen, we need ventilators, we need pharmaceuticals, we need respiratory therapy, we need imaging. We have to get it all together to make sure that we're able to care for patients as safely as possible. Staffing resources and mobilizing, predictive modeling, which is so important. And I think that's another thing with innovation and healthcare and statisticians out there and kids in engineering and math. Predictive modeling for healthcare is ever so important with virology, with viruses, and understanding the different disease states that we need to take care of. Transfer center expertise, taking care of our patients in the rural facilities and making sure that we are able to communicate and get patients to a higher level facility as quickly as we can. Pharmaceutical resources, which I've mentioned, and then public health attention. I think this one is so important. Public health matters and impacts all of us. So the hand washing, the hand hygiene, the vaccinations, the taking care of the masses, even though it is so hard to comprehend, but taking care of the masses impacts you as an individual downstream in some way, shape, or form. And going back to the graph, that was only one diagnosis. That was COVID. We didn't have COVID. When I was in medical school in Chicago, when I was in residency in Omaha, Nebraska, COVID did not exist. We did not learn about it. We did not treat it. It was not a part of my differential diagnosis. I'm a hospitalist, internal medicine physician by background. It did not exist. Those patients were all new. So think then, what about the heart attack, the trauma patient, the stroke patient, the patient who needs their appendix out, the patient who has Alzheimer's dementia and needs a memory care unit? We have to manage all of our usual diagnoses on top of the graphic that you saw. And so our workforce changes. What we saw is in 2020, the Great Resignation, and that's national. We're going more into national, not just Northern Colorado. 30% of nurses left the hospital arena. And I think the graphic speaks to the why. The Delta was really hard. 2021 was really hard. Contract nursing labor costs hit an all-time high of $200 an hour. Really challenging for bottom lines for the hospital. Dramatic increase in high acuity ED visits and behavioral health. Inflation, very challenging with our inability to change pricing, our supplies, things that I've mentioned that we need. Cost of living is higher in this area. The violence amongst healthcare workers has increased significantly. Very challenging. And if you walk away with anything from this presentation today, we need grace and gratitude in medicine and patience. Things are taking longer. It's harder to get in because we're in this period of needing that innovation that has been talked about, and we'll get there. And we're going to see a different healthcare in the next decade. And it's going to look, I'm excited. I think it's going to look awesome because we are going to have more innovation and it's going to be different. But in this decade, or probably 5 to 10 more years, we're still recovering from that graphic. And so things are going to take time. So grace and gratitude is so important as patients, and to give it back to the nurses, physicians, respiratory therapists, everyone who works in healthcare. Many physicians took early retirement, transitions to part-time, or they moved out of state. So this is kind of by the numbers. I'll go through this quickly, but 87 is the average number of days, regardless of specialty, to recruit an experienced nurse. It's like 3 months. That is incredible. 52, let's see what 52 is. 52 is the median age of nurses in the United States, and more than 1 of 5 nurses say that they will retire in the next 5 years. So think about that. 36. 36 is the number of students graduating from UNC each semester for nursing. We need more education, more professors in our universities, larger classes for our nurses, and for respiratory therapy physicians. To the gentleman who spoke, that healthcare is not only nurses and physicians. I loved that. It's true. We have to educate so many who are in the healthcare industry in our universities. 11.77. This is a Banner Health number in regards to the number of average sick calls per day. And just to give you an idea of pre-pandemic, that number was about 5 per day. So we've over doubled it. And part of that too is the Colorado sick time and people calling off. imagine schedules and patients and again, that the ability to operate when we need all of the resources that we possibly can have, then we think we have the resources coming, and then we have to adjust and flex with people calling off sick. It's very challenging. $87.97. This is a national statistic. It's not a local one. It's the average hourly pay for a med-surg travel nurse. Our contracts, as mentioned before, when it reached an all-time high of $200 an hour with the contract agency, I think in this region right now, we're at about $110 to $150 an hour for contract agency for a nurse. And that is the average hourly pay for them across the country. It's very high. And $38 is the average hourly rate for a core med-surg nurse in Colorado. So a core nurse is one who has been here, been in that job. The traveler is the contracted labor. And look at the difference in those two in terms of pay and what impact that might have. 24% is the national average for nurse turnover in under 1 year, which has been mentioned. $60,000 is the average cost to onboard a new graduate nurse. And I think in a specialty care, it reaches almost $100,000 to onboard one nurse. And 1% is the change in nurse turnover that saves the hospital about $270,000. So one of the things, and it has been discussed today, our nursing supply, we need nursing supply. The supply and demand, the demand for nursing is so high that we have to think creatively in terms of nurse residency programs, innovation with nursing models, apprenticeships, collaborations, and many of the talks here, the power is in this room. And it's exciting to hear from others because I do think that we're going to get there in terms of creating a new workforce. But right now, understanding and being aware of our situation is we need to really focus on our nursing, wellness and nursing, career development, mentor programs, as has been discussed. So future state. And are we there yet? That question is an interesting one. COVID will always be a diagnosis now. It's in the differential. It's part of the medical books. It's COVID. Viruses tend to go up and down. We have influenza. We have RSV. And they always go down. Any surge will come down. And I think it's important to realize that. And I think it's important to respect, though, that when it is going up and when we are surging and when there are requests and needs for the community to join together to really address population health, it is so important for our hospital and medical care system because you will be impacted in some way, shape, or form, even if you're just going to a clinic visit and haven't been impacted by whatever public health emergency might be going on. We need nurses, healthcare industry innovation, healthcare industry jobs, and physicians. This one's important. The literature out there, and please read it or just search it. The physician shortage has not been visible yet. The nursing shortage is visible. And there are predictions that in the next decade, we will be experiencing a significant physician shortage. So I think also with all of the education programs, the mentoring, the get into the guts, I love it. Getting into everything, brain, heart, lungs, skin, everything. We need to embrace our youth in terms of healthcare and really encourage them to consider medicine, because I do think that what we will face in the future will be challenging with the physician shortage. And so preparing for that or trying to prevent it, better yet, will be really important. I have this on the other side, which is, I hope, familiar from the COVID crisis and what we've learned. A lot of positive things have come from what we have learned in working together. And communication is so important. We still have to redeploy and upskill. Asking nurses, physicians, hospital employees to consider taking this course or getting this certification and considering upskilling is going to continue for years to come. Resource utilization, constantly thinking of, do we have X, Y, and Z that we need for the populations that are coming in. Staffing resources have been looked at in a new light, and that predictive modeling one is, again, something that for me personally has been relatively new, and it's fascinating. And to get more people involved in predictive modeling for healthcare will be very helpful. Transfer center expertise, the pharmaceutical resources, and really diving into that. And lastly, but honestly most importantly, is the public health awareness that what is affecting the masses does not seem to be impacting us individually on a day-to-day basis, but realizing that what is happening to all of us as a community has downstream effects is so important, and that each one of us plays a role. I did leave my email here, so please feel free to reach out to me with any questions. Thank you.
If everybody could grab their seat, we're going to go ahead and get things going. As promised, our next session is called Supporting Employee Behavioral Health. And to introduce this topic, I'd like to introduce our gold sponsor. President and CEO of UCHealth Northern Colorado, Kevin Unger, is going to bring on, going to bring on our next speakers. Thanks a lot.
Hi all, hope you're all doing well, and thanks for being here. It's so nice to see so many friendly faces in one place, and when Dr. Mills was talking about COVID, bringing back flashbacks, and I was like, I'd blocked a lot of that out, and it like opened the wounds. But who would have thought that we would have, I know we just kept saying, can't wait till the pandemic ends, can't wait to get through this, but it hasn't gotten any easier. And I know I was just talking to Betsy, who supplies our emergency room doctors, and every day we're seeing record volumes through our EDs. So the volumes are up, staffing's down. Our employee behavioral health has never been more important at this point. So our employees are facing unprecedented challenges. You know, even the 2-hour delay yesterday with school starting, that put stressors on people. A lot of things happening. Our patients, have you noticed they're a little more snarky than they were pre-COVID, as well as their families? And so our employees are dealing with a lot of challenging patients and families, and I know we're investing heavily in behavioral health within UCHealth. So we're focused on the patient side. We're investing about $120 million to try to at least start to chisel away at some of those behavioral health needs, but we're investing even more heavily with our employee population. About $277 million is going towards employee well-being and making sure that we're doing the best that we can to take care of our staff, because without our staff, we can't take care of our patients. And so this is a huge issue, and our next panelist, who's going to be led by Carolyn Bunn. Carolyn, if you don't mind coming on up front and introducing our panel. We're going to be talking about employee behavioral health and well-being. Specifically, if we can help on the physical side, that's important, but I think actually the mental and behavioral health side is equally or more important at this point. So with that, I'll turn it over to Carolyn.
So Kevin Unger is my opening act, everybody, just so you know. I'm very important. So my name is Caroline Bunn. I'm a community engagement manager with Unite Us. We're a technology platform that connects healthcare with social care to improve people's social determinants of health. Today I'm joined by Kim Collins from North Range Behavioral Health and Wade Heiss, who is with Rocky Mountain Crisis Services. If you both could come on up and join me. And really, in my mind, we were going to have like a living room set up today, but my dreams did not come true. So I'm just going to go ahead and sit down with these guys because we're just really going to have a conversation around employee behavioral health and how we can all support that. Okay. No one wants to break. I think we might just pass this one around. And so I think really in every single session today, we've heard something about employee behavioral health and how it's been affected by the pandemic. And I don't know that employee behavioral health was really that great before the pandemic. And so, I want to take a step back and introduce my panelists. So Kim has worked in behavioral health for more than 15 years and has been with North Range Behavioral Health for 8 years. And if you did not know, Kim is going to be the new CEO of North Range Behavioral Health. No big deal. Kim, have you already started? Yes. Okay, fantastic. So she is the new CEO. November 1. Okay. Well, I knew Larry's last day is tomorrow, so that's why I was asking. And then Wade is a supervisor with Rocky Mountain Crisis Partners and oversees staff who are responding to crisis calls. So very, very important work here in Colorado in behavioral health. And so my question for both of you to start off with is, how, and I think all of us here today can think about our own behavioral health and the behavioral health of our colleagues and our partners. But how do you two see behavioral health affecting our workforce?
I guess I got the mic, so I guess I should talk. So I guess, with our line of work with mental, our staff deals with a lot of trauma when obviously they're talking to people calling in who are in a crisis or, specifically are wanting to kill themselves. And so we deal with the mental health with our staff very closely. And it's very important for us to make sure that they can maintain just composure to get through these calls that they're exposed to all this trauma. And so we do a lot of things that that help with that. One of the big things, and I'm sure that you hear this term a lot ever since COVID as well, is self-care. And it's always really important to check in with them, especially when I meet with them weekly or monthly, and I just make sure that they have effective self-care, whether it's in the moment during a call, whether that it's something where it's activating or triggering to them, or when they leave at night so they can leave everything behind and they can make sure that they take care of themselves. Whether it's self-care can be going for exercise, going for a run, or cooking, or just watching TV. And so, before I talk too much, I'll let Kim talk too.
Thank you. So ditto to everything he said. And just a really, really quick straw poll. Raise your hand if you had any kind of an emotional reaction throughout COVID. Right? Yeah, if you didn't raise your hand, we need to talk because I'm highly suspect. So here's what we know. The unfortunate thing, and maybe a fortunate thing about COVID, is that it is a great unifier in the behavioral health world. Everyone has been impacted by it. What's fascinating is if I would have asked that question, how many of you have had any kind of an emotional something in 2018? The hands would have looked different because of stigma, because are we as helping professionals allowed to show that we struggle sometimes? Does that mean someone wouldn't trust us if they think that we have faced our own challenge? So it's a fascinating thing. The innovations and then that one unifier are the two great lessons that I think our field has come out of COVID with. What I would share is even with our staff, we certainly are experiencing the same workforce shortages. Clinicians, especially licensed clinicians, are like beautiful unicorns. If any of you are licensed clinicians out there in the behavioral health field, please see me afterwards. I would love to buy you a coffee. And what we know is just like what has been shared, the pipeline is beginning to shrink up. And I think it's because right now, the mental health, the stress challenges that all of our workforce is experiencing feels not, there's that saying, is the juice worth the squeeze? There are a lot of folks out there that are saying, you know what, I'm not sure that that's quite worth it for me. So whether you're working as a crisis worker, or whether you are seeing people in an outpatient setting, or you're a psychiatrist, or you're a nurse in an emergency department, all of it does take a toll. I think we've done a really good job of figuring out exactly how to manage infection and lots of transmission rates and respiratory things. We know some of the things that keep us safe. What our workforce in general right now, I am hearing is screaming for is, okay, cool. We know all about PPE. We know all about distancing. We know all about hand washing. We know all about these things. There's vaccines. There's all this stuff. But my spirit is broken. And who's going to help me with that? I am exhausted going into my work setting every single day and feeling like I'm not helping enough. So I think that mental health is mental health, and everyone has it. And some days it will be more challenging than other days. Some days you need support. But I can promise the majority of our workforce, the Great Resignation, our workforce challenges, even our educational pipeline shortages, if we don't start paying attention to how we take care of people's spirits, we're not going to make as much progress, and we're not going to crack that particular nut as quickly as what our community needs for us to.
Thank you both. So my question, because we've heard a lot about how people are affected by, people's behavioral health has been affected, and particularly with the pandemic, and we all had stressors in addition to work during the pandemic. Some of us were caring for parents. I had a baby. Anybody else have a baby in the middle of the pandemic? That was fun. And so as some of us, Kim, how old are your kids again? 7 and 9? Yeah. Homeschooling while you're a CEO. That's cool. So, I mean, we all had our struggles that we were dealing with. And I love that a silver lining of the pandemic is that it decreased some of the stigma of being able to talk about behavioral health in a different way than we ever have before. So we know what's wrong. We know that we're hurting, and we know that we're surrounded by people who are hurting. What can we do? What are some solutions? Where's the fix? Fix it.
So some of our solutions, I guess I talked about the self-care thing, but one of the things that we've noticed that we started implementing back in May was more collective care. Our staff, a lot of them are remote now. That's a huge draw to get people, is just offering remote. So the majority is that way. But because of that, they can feel sort of alone. And when you're feeling alone, especially in this kind of work, you get burned out. You don't feel like you're connected. And we do have a message system over our computers where people are able to talk to each other, but it's not the same because they don't get to see each other face to face. So we have started something back in May called Supervision of Solidarity, where we try to get 5 people to gather on Zoom for an hour, and 5 to 3. You know, it's smaller group is sometimes nice too. But during this time, we don't really have anything structured out. We just want them to start talking, and the whole idea is to sort of see what kind of stuff they're dealing with in that work. And so this whole time, you know, there'll be a supervisor just sort of there to help monitor, you know, in case it gets off of topic or a little bit or doesn't really fit with the model. But we do this twice a month. So then, you know, they're still clocked in. And so it's sort of nice for them to get a little break during the day to be able to meet the others. And it's not always the same people that they're with. And that's the cool part, is they get to meet other people. And then I've noticed and have heard that they will then private message each other more during the workday. They'll feel more supported because they know more of the staff, and they know what the others are going through, so they don't feel alone anymore. And so that's been huge. I've seen just a lot of positivity from it. People look forward to the group of, or the supervision of solidarity, because they already have things that they sort of want to talk about, or they're just excited to hear, you know, what others have to say. And it's not like coming up with solutions with things that they want to talk about. It's more, you know, sort of what they do on the phone calls with our callers. They're being supported, but they're being supported by their peers, and that's the awesome thing. So
that sounds really good. I'm glad you guys are doing that. So we also have similar conversations in our workforce as well. One of the presentations that we do in the community pretty regularly, but also we've done it for our own staff when appropriate, is what we call compassion fatigue. And it's basically just recognizing that when you're in a service industry, when you're in the human services industry, it wears on your humanness to continue to serve and support the communities that we are, and see some of the challenges and the heartbreak and the trauma that we see every day. We are seeing horrible things and hearing horrible things, and that has to go somewhere. So we talk, certainly, of course, most employers have EAP and different kinds of support services when something's hitting really close to home and someone wants to unpack that with a trained professional. But we also think that there is a level of just living a well life. And so there are a ton of different wellness plans out on the internet. When you are thinking about how to take care of the spirit of your particular workforce, I would highly recommend a couple of different things. Try to really debunk some of the self-talk that might be happening in their heads. Call it out and give them permission to call it something different. If wellness plan sounds too foofy, call it the survival plan. If saying self-care feels self-focused, sweet, call it something different, but relabel it. In my experience over the few years that I've been doing this, a lot of the burnout that I've seen in our field has come from a couple of different kind of self-talk thoughts in our clinicians. So on one hand, there are clinicians out there who are saying, I can't work harder than the clients. They don't even want to change. They don't show up to their appointments. They no-show. They're always late. They're not taking this seriously. And that, said enough times, helps you live in a place of judging and even potentially feeling anger towards the people we're trying to help. And that's a path that can burn you out pretty quick. On the other side of the hand, there are folks who are like, I need to save everyone. I have the fix, and if they would just tell me about their mother and their childhood, we would figure this out together and it would be fantastic. I need to put in extra hours. I need to work extra shifts. I have to figure out how to help our community and save them. That's exhausting. The Superman complex is exhausting, and you can't sustain that for long. So one of the things we did with our managers that has then trickled down to some of our teams is we really have kind of worked through, there's a book out there called Burnout, and I think it's Unlocking the Stress Cycle. If you have not checked it out, I encourage you to check it out. It's not all behavioral healthy. It's a really concrete, helpful look. And really what it says is you're undergoing stress, whether you realize it or not. You need to know how to complete that cycle close that chapter in order to move on instead of just accumulate it and accumulate it and accumulate it. Maybe that's about sleep. Maybe that is about exercise. Maybe that is about laughter. We've had a lot of staff who have said, during COVID, I watched stand-up comedy because that released my stress. And so it's a wonderful book to just take a pause and say, how are you managing, carrying the load that you're carrying? And let's give you permission to not save everything and be everything to everyone. But let's also give you permission to not stay in that place of not having hope or having frustration or anger towards the people that you're trying to help.
I also wanted to share, sorry.
No, take it.
So I talked about more of the group aspect, but as she was talking to, I realized, there's more of that in the moment when you're working and you're suddenly then feeling a lot of pressure. And so one thing that, or some things that we do, we have a lot of opportunities for them to talk to supervisors. We have some supervisors that are like in the moment, they listen, they're listening to calls and stuff, or they will hop on if we have a specialist that's having a difficult time being able to navigate through the call. And so after the fact, we give them an opportunity to debrief, or as we call it, a consult. And so there's always that option for them. And then also if it's something that needs a little bit more time to sort of unpack and stuff, then that's where my role comes into play, where a supervisor will have more time and be able to talk to them. The idea is to get to them to a point to reset, to be able to get back, get focused, so they can be all there and present for the next call. And so resets are really important for us. If it's like an extra break, we're okay with that. And so also, we don't shy away from letting people know if they need to take a mental health day, if they need to leave for the day. Like, we want them to be able to bounce back and just be ready to be present for their, their next shift. And so.
Awesome. Thank you both. We, this time went by really quickly, and really, I think we could have talked about this all day and had some really important discussion. One last thing I want to add, and I want to encourage everyone, particularly the leaders and the supervisors in the room, is to look at, and this is a little bit of a soapbox for me, so I'm sorry, not sorry, but look at what you're saying versus what you're doing. I'll share, the last organization I worked with, I would get emails from leadership, my boss and people above him, from all hours of the day and night, on the weekend, any other time. Anybody else experience that? Yeah, y'all are lying. More of you see that. And so, and also, the organization I work for now, if my boss were to get an email from me at midnight, we would have a discussion about it the next day of what's going on. Why are you working at midnight? You've got a 2-year-old at home. You need to be sleeping. What is up? Are you okay? We also have a hard and fast rule across our entire region, and this starts with our top leadership of when you're on vacation, you are out. You are not responding to emails. You are not responding to phone calls. My last boss would check emails when he was out of the country. And if I did that now, I truly would get in trouble. And so really thinking about how are you as a leader taking care of your own self-care, and how are you, again, giving an example for your employees, and what does that look like? Because if you're not doing it, it doesn't mean a whole lot. Any other last words from you two?
I guess, with what you just said about taking care of yourself as a leader, that's something I struggle with. But luckily, my supervisor, we check in weekly with my goals of setting boundaries. And so they know that struggle for me, and they know that could also possibly get me burned out. So I have, set boundaries with my staff that, hey, when I'm off, and they understand that, but they also know who they can go to because we're 24/7, so there's always someone available. And so I just want to emphasize that is really important. It's harder said than done, but if you have support around you to help you with that, it's a lot easier.
The last thing that I would just offer is if you haven't thought about what would work for your team, just talk with them, ask them, try to normalize it, say this is hard for everybody, it's hard for all people right now. And just because we come up with something that rejuvenates us or that restores us, doesn't mean that there's anything broken or wrong. Marathon runners stop to go to the bathroom, they stop to have a drink, they stop to get food, and at some point the race stops for them to rest before they start running again. I think we need to normalize that. We need to help them to cleanse their palate of the stress a little bit before they come back to fight another day. And the other thing that I would say is an antidote for burnout is passion and joy. So figure out how to incorporate, go to their why, to use Simon Sinek in some of his work, look for the why out there of why they got into this field and help them understand that their presence matters. They're making a difference. They are helping people. That will fill them up because what they go home and they think about are the people who told them off and the people that they didn't feel like they got to soon enough or the case that didn't go well. So remind them to think about the impact that they are making, and that will help them to fight some of their own feelings of burnout.
Also, I wanted to say about the burnout book, if you're not going to read a whole book, Brene Brown did a podcast with the authors, which is a really amazing synopsis if you only have half an hour, so check that out. But thank you so much to Kim and Wade both. I loved this conversation. I hope you did too. And with that, I need to bring my buddy Jonas back up to the stage.
Thanks, Caroline. Okay, we're going to get the mic figured out here because I'm going to need it for our next group. So, we're all good? Awesome. So our next session is mine, so I'm really excited about it. And we're going to talk to some primary care providers and get some different perspectives. So if I could get my three folks up here, get you guys seated. So the title of this topic is going to be The Doctor Will See You Now, Conversations with Primary Care Providers. So we have Craig Lazinski with Village MD. We have Dr. Jennifer McCabe-Lenz. She is with Direct Family Care of Northern Colorado. And I have Lane Maddox with Family Physicians of Greeley. So if you guys wouldn't mind just introducing yourself a little bit, maybe your role within your organization, I would appreciate it.
Sure. Can you hear me? No. Testing. There we go. Back on again. All right. My name is Craig Lazinski. I am currently working for Village MD, and I am the market president for Colorado.
Hi, I'm Jen Lentz, and I own my own business. I own Direct Family Care, and I am the owner, doctor, web designer, IT guy. I do all of it.
I'm Lane Maddox. I work for Family Physicians of Greeley. We're an independent family practice group in Greeley and Johnstown. I'm a manager there, been there for 15 years. I handle the EMR, data, and I'm kind of the numbers person.
All right, I'm actually going to start with Craig, put you in the hot seat first. It took everything I had to say you're with Village MD. That's a fairly recent transition. So I was wondering if you could just talk to that transition from AFM being acquired by Village MD and whether maybe some of the market factors or things happening in primary care led to that decision.
Yes, this is not the first time I've been asked that question. So I'd briefly like to talk about what was a very thoughtful, rigorous, and intense process that we went through the last couple years. It actually started more than a decade ago when the leadership at AFM at the time, and AFM is a large family practice group, 9 clinics. Now with Village, we're up to about 13. in northern Colorado and has been here for 60 years. And so deciding or looking into partnership was a very intense process and thoughtful. But it went back about 10 years when we started to look at what were our options for partnerships, sort of looking at the future of where healthcare was going, looking at where future reimbursement was going. At the same time, we had dedicated to becoming more of a value-based organization, looking at future reimbursement strategies. We added medical social workers, pharmacists, care managers to help support the physicians at that time. Although we were very successful at that time, we recognized that many of the insurers were making a lot more profit off of us than we were receiving from them. And even though we were large, we had 75 providers and about 400 employees at the time, many of the insurers were not talking to us. They didn't think we were big enough to go into larger risk agreements, which we wanted to get into to not only improve health, but to make more money as part of being in healthcare. I think the culmination of the decision to partner happened at a retreat in 2019 where we got all of the 40 owners of AFM together to sort of look at what did we want to be when we grow up and recognize the market factors. At that point, they said, let's start to explore our options, which we did, and started to sort of get our name out there that we were looking at an option. And Dr. Kessler, who's my physician dyad, said it was like being on acquisition Tinder, and my wife is in the audience, so I know nothing about Tinder. But it was a lot of people started to approach us, and the main goal for the owners at that time is to a balance of remaining independent and a new definition of independence, but have an autonomy in practice. And so they wanted to find someone who would balance that, who would continue to have the same values that AFM had for 60 years, a focus on value-based care, and then being able to scale, because we realized to have a little bit more influence with payers, we needed to get bigger. And that's happened immediately with Village. We've already reconstructed our agreements with Humana and United Health, which in the past they would hardly look at us. So I think that partnership has been a benefit to our owners, our staff, and also to a little bit more respect from some of the payers as to the value that we bring to the members that are part of those insurance groups. So that's in brief a long process, but and we're still in integration. It's been only 7 months since we joined Village, and we have a lot to learn, and they have a lot to learn from us because we do some things exceptionally well that they're learning from and sharing through their organization.
Thanks. Jen, I'll come to you next. So you mentioned you own your own business and started that. My understanding is you kind of came from a more traditional practice within a clinic. And would you mind talking about why you wanted to go into direct primary care and maybe how that's been a little different for you? And
yeah, absolutely. The biggest reason that I left a system and started my own clinic was self-preservation. No family doctor goes into medicine thinking that their biggest tool in the exam room will be their computer mouse as they click all of their measures that they need to take care of, as they spend 10 minutes with a patient, not being able to counsel them adequately, but instead, here, have another medication, because I don't have time to teach you how to do it otherwise. And so I opened my own practice where I could take measures out of the whole equation and also take insurance out of the equation, because the other thing that really injures physicians is I want to treat my patient this way, but I have to go through 6 different steps to get the insurance company to say that I can do it. And so I don't even deal with insurance. I am a direct care, direct me to the patient. We are not the same as concierge medicine. We don't bill insurance in any way. We don't take co-pays of any kind. We have a monthly fee. If you pay the fee, you get all the care that you need in my clinic. And that includes all the testing. We do the EKGs. We do all the stuff in there. We try to find the best prices for all of our patients. So we know which imaging centers have the $470 CT scan versus the $3,200 CT scan. We have wholesale medications, and we have very cheap labs where we can do TSHs for $4 instead of 50 whatever, you know. And so the other thing is I have 4 kids, and for the first 12 years of their lives, I never even saw them in the morning. I'd go to work, I'd work through lunch, I'd come home, I'd see them, I'd work more at home, and it'd be a hamster wheel day after day, and it was just very difficult. And now I have coffee and watch them eat breakfast every morning, and it's just been so life-saving.
Thank you. All right, Lane, we'll come to you. So Craig mentioned the Tinder situation that happens if a primary care physician practice these days says they're potentially interested in partnering or being acquired. Family physicians at Greeley, I have to assume that people have either approached you or you've at least talked about it. Would you mind talking to maybe some of the factors in Greeley and why you haven't done that? Kind of your situation, maybe how it might differ from where Craig was at AFM.
Yeah, associates in family medicine, we've always considered them kind of our cousins. We're experiencing all the same pressures and frustrations that they have, and yeah, have looked closely at a lot of offers to be acquired also, but haven't done it. We mainly were looking to kind of know what our options are if things were to get more painful, or they had a vision for what they wanted to be, so if we have a sudden change or a sudden new vision, to know what's out there to help us do that. But right now there's not a pain point for us that we think an acquisition being bought out would help us cover, that would compensate for what we perceive as the doctors perceive as a big loss of autonomy and independence, which they love. And so we haven't gone that way. We're doing well enough in terms of revenue, and we are doing well in our population health measures. One big factor that Craig mentioned that is an impetus for acquisitions is getting a bigger panel. So insurance companies take you more seriously, so that you can be involved in risk contracting. That means getting a cut of what the insurance company's getting. We did that to some degree on our own by having most of our Medicare patients go into a single Medicare plan. So we're in on risk contracting list, at least with Medicare Advantage. And then I think the biggest reason we've stayed independent is our ownership structure. All of our physicians are owners and equal owners. So like Dr. Wilson, who joined in 1980, has the same stake in the company as Dr. Nightingale, who joined last year. So there's not a majority ownership group. There's not a chunk of older doctors who might be getting close to retirement that might have an incentive to sell out. I'm not saying that's what happened at AFM, but at other places that get acquired, that's part of it too. So we've got this source of stability in our ownership structure, I think.
Great. We'll stay with you, and then we'll kind of work our way back. For the next question, it'll be the same question for all of you. So one thing I hear, so I'm on the health insurance side of things at UCHealth, and I hear consistently in Northern Colorado that it's hard to get into a doctor. So we've had huge population growth, lots of new people moving to the area, and when they call around, they're hearing that panels are full, that their places are not accepting new patients. I just wondered if each of you could kind of talk to how you've experienced that in your own clinic, and maybe some things that you're doing to address that, if it's an issue or if it's not an issue.
It's been a big issue for us up until recently. I can bounce back to that. We've most of our PCPs, our family doctors and PAs and NPs have been closed to new patients, and it's happened earlier and earlier. Usually it's, in the past it was maybe an older doctor, but now it's, after you've been in practice for 2-3 years, you close up. And yes, the physician shortage is certainly part of that, but what we've seen is the past 10 years, providers have chosen to see fewer and fewer patients each day and have much smaller panels to get off the hamster wheel. And that's a good thing. It's the incentives in the business are incentivizing us to take better care of the patients we do have. So don't see someone every 10 minutes. Take longer with them. There's more counseling involved. There's more meeting quality measures, coding correctly, things like that. Of course, the EMR is a big part of the slowdown too. But so they're making these choices to see fewer patients, have smaller panels, and that has contributed to people closing up early. Now, coming out of pandemic, we're seeing lower volume during pandemic, of course, but then it never came back. We were at maybe 90%, 95% of charges coming out of pandemic. So this summer, all of our doctors opened up to taking new patients.
I don't really have a problem with any kind of patients getting in. The biggest obstacle is people are so married to their health insurance that they'll call and ask if we take it, and they don't realize if they have a high deductible, we can actually save them a whole lot more money than if they use their insurance. But that's our biggest obstacle. We get people in same day, next day. We spend 45 minutes to an hour with all of them if they need it.
Maybe a better question for you is, have you set a limit? Have you set a target for how many patients you would take? Have you kind of set your own panel to say to maintain my model and kind of how I want to be able to treat patients? And is that different than what you did previously? Are you taking less patients in your current company, or?
So I don't really have a limit set. I know how busy I want to be. Right now I have another doctor that I'm trying to build her practice, so I'm not taking as many because I'm feeling pretty happy with going home at 3 p.m. some days. But I still work from home. We have tech going on all the time, patients sending messages, we do video calls, we do all of that just fairly constantly. But no, I don't have a limit yet, but
good.
If I get there, I'll stop.
Thanks. Access is probably our number one issue that we're working on right now. Our, what we call attributed lives, is probably close to 85,000 that's associated with our practice. So many of you in this room are probably associated with Associates in Family Medicine, Now Village. So it's a big deal, and we do not want to have people have to wait for extended periods of time to get into care. And so we are working hard. The issue is the physician shortage, and I left the thing on my article on my table over there, but there was a recent article in Becker's report, a research that said that 350,000 healthcare workers left since the fourth quarter of 2021. And a significant amount of those that left the practice were internal medicine and primary care docs. And so when we're trying to grow to take care of 80,000 people and get them in on a reasonable basis, we need to add more providers. I think the issue that we've taken is that we use a team-based approach, and that many individuals don't need to see a primary care provider. They need a physician, APP, or APP, which is a PA or a nurse practitioner. They may need to see that individual to coordinate care, but we can do as effective or better care with a pharmacist, a nurse, or a medical social worker in many cases. And so I think from a consumer perspective, we need to look at the shortage of physicians, APPs, and nurse practitioners, and start to help educating them that, yes, seeing a physician is important, but we can take care of their chronic illnesses or even acute illnesses with a team-based approach. And then part of it is joining with Village. It gives us a little bit of capital to expand into new facilities and build new facilities, which I think will help. The problem is you can build facilities, but you can't staff them. That's a whole nother issue. And we're experiencing a little bit of that, but it's just slower than what we would like from a development perspective.
All right, one more question. Same kind of ask all of you on this. So what gets you excited about future of primary care in Northern Colorado? Is there anything that you're excited about in the community, in your practice, that you would like to share with the group?
Yeah, I get excited about the challenge of looking at how we're going to take care of individuals, but also the health of a population. Primary care that's why many primary care physicians went into it. They're not specialists dealing with just this one thing. They look at the whole patient. I look at the excitement of many of our physicians that they have a team-based approach, that they can work with a pharmacist, a social worker, a nurse to take care of more than just their medical issues and be really successful and have lower ER utilization and in-hospital care, better diabetes care, better care for hypertension. So when we look at our metrics, it's nice to see that we're actually making a difference for the individual, but also for populations of people as well.
I'm just excited every day. I love what I do. I have been continuing to educate myself, and I'm also a metabolic health practitioner, and so I'm very excited about trying to grow a practice where I can teach people the right way to eat and the right way to do things and bring balance and sleep and all of these things into it. And I'm every day I try to figure out where I'm going to go with this, but that's why it's so exciting, because every day I could change whatever I want. And it's beautiful.
There's a new osteopathic medical school coming to UNC in Greeley in a few years, and that's exciting for our practice because DOs tend to be more primary care minded, and so we'll have people coming to Greeley, people coming to Northern Colorado that want to get into primary care, and hopefully they end up loving Greeley as much as I do and stick around for residency and maybe join private practice. So that'll be good.
Excellent. Well, thank you all three. I appreciate it. Appreciate you being here today and sharing your thoughts. And yeah, thanks. If you guys could thank them. All right, so we're going to switch gears a little bit. I'm going to bring Carol Salter up to introduce our next program. So Carol Salter is the Program Manager Nursing Shortage for Larimer County. Let's welcome her. Thanks.
Thank you. So our next session is one of my favorite things, politics, legislation. And I looked at this script that says politics. It isn't taboo, it's tantalizing. And I thought, who came up with that tagline? And then I remembered it was me. So there's not too many people that love to sit by the fireplace on Saturday morning and read legislation and go through policy, but I am one of those people. And I'm so pleased to be able to introduce someone that's just like me. So Lisa Ward is our guest speaker today to talk about legislation, what happened last year and what's coming this year. Lisa is a lobbyist and government relations consultant at Frontline Public Affairs in Denver. So prior to her work as a contract lobby firm, she was the lobbyist for Denver Health, a policy coordinator for the Health District of Northern Larimer County, and a legislative aide to Senator Rhonda Fields. She holds a bachelor's degree in criminal justice and criminology from Metro State University and a master's in healthcare policy from the University of Denver. Now, this is the most impressive part. She continues to work in the emergency department at Denver Health as an EMT. And she currently serves as an appointed member of the Colorado Department of Public Health and Environment's EMS Systems Sustainability Task Force. Please join me in welcoming Lisa Ward.
Yes, go right ahead. Oh, yes. Have a seat. Thank you. I'm actually going to sit. I hope that's okay with everybody. And I'm going to start a timer because if you know anything about people in politics, we like to talk. So I want to make sure I leave time so that I can answer some questions if anybody has questions. And I think I actually have oh, here we go. Actually, it might be better if I stand so I can see this. So we're just going to talk a little bit about what happened last year, all the healthcare legislation that passed last year, and like Carol said, what's coming this year, which is probably the most interesting part. So last year at the Capitol, we had a total of 657 bills, and that's in 120 days. Ladies and gentlemen, that's a lot of bills. So 513 of those passed. We had a $35 billion state budget. That included $2 billion in federal pandemic relief funding and $1 billion in state revenue spent on short-term programming. So This year, the 2023 session will begin on January 9th. So let's talk a little bit about what passed as far as healthcare costs, access, and the workforce. So I'm going to go through these slides pretty quickly. So it's my understanding that you all have access to the slides when we're done. So just kind of put your pens down and you can take a closer look at these later. So this is just some of the legislation that passed last year. HB 1284 was the Colorado Alignment with Federal No Surprises Act. 1285 prohibited hospitals from debt collection if the hospital was not complying with the federal hospital transparency rules. Senate Bill 053 was the visitor policy, the no visitation policy. That bill actually took 2 sessions to pass. So that bill was introduced in what we call the special session in 2020 when the legislature shut down for COVID, and then it came back in 2021 and again in 2022. So again, just a little bit about what passed last year. The public option, which passed in 2021, is actually now being implemented. So this is the first year that it's on the exchange. So if you know anything about the public option, it's a standardized plan with targeted premium reductions. It has it was designed to include a bronze, silver, and gold level coverage. So it's now being offered on the exchange for people as an option for their healthcare coverage. So we can talk a little bit more about that if you want to talk about that. HB 22-1289 is a bill that passed last year that I was very excited about and lobbied in support of. This is the health benefits for Colorado children and pregnant persons. So what this bill did is it creates a mirror Medicaid program for women who are pregnant and children under the age of 19 who are undocumented. So these people will get health care coverage that mirrors all the benefits of Medicaid beginning in 2025. So HCPF is right now starting to implement some rulemaking around this. Let's talk a little bit about the workforce. I know we've talked a lot about workforce today, but just about what we're doing to help the workforce in the legislative process. So SB 22-226, these are programs to support the healthcare workforce. These are just some specific programs that are implemented throughout this bill. So what have we done since 2022 to implement these since the last session? So the session ended last year in May. So what have we done since May to try to implement this? So we have the Care Forward Colorado program, which I was sitting at the community college table, so I know that they're familiar with that program. It's a wonderful program that started in the fall of 2022 at all community colleges and technical colleges, which pays for tuition, fees, and course materials covered in 13 entry-level healthcare positions. And these are positions like certified nurse assistants, EMTs, phlebotomy techs, lab techs, those types of career fields. CDPHE has a $10 million fund for healthcare worker re-engagement. The governor just came out with an announcement about this last week, so this is now being implemented as well. Organizations that operate as a long-term care facility qualify. Organizations that hold an official federal designation as a health professional shortage area and hospitals that serve the pediatric population. If they recruit nursing, certain nursing workforce into their facility, they receive a one-time payment of $20,000 per re-engaged employee. And there are some parameters around that, but it's really a wonderful program to get people re-engaged. Senate Bill 181 was the Behavioral Healthcare Workforce Bill. This was $72 million in IRPA funding. So IRPA was the COVID relief pandemic funding. Again, we have seen some implementation already from Senate Bill 181, and that is listed here. You can just take a quick look at that. And there is a link also on this slide that will link you to the actual workforce report. So you can take a look at that. That was written by the BHA, the Behavioral Health Administration. And let's talk a little bit about behavioral health. Of course, we have the new Behavioral Health Administration. I have heard Dr. Metlock talk at several different places at this point, and the Behavioral Health Administration is off and running. So lots and lots of things going on there. They were tasked with, by July 1st of 2024, establishing a statewide behavioral health grievance system, a behavioral health performance monitoring system, a comprehensive behavioral health safety net system, which is up and running or in the stages of rulemaking, and how do people and how do clinics and how do safety net systems, how does everybody become a safety net system? Really, that's what we're looking at now. There's so many different aspects of the Behavioral Health Administration. It gets a little complicated, but again, happy to talk about that if you want to talk about that more. So let's talk a little bit about the IRPA funding. Again, this is the American Rescue Plan funding, the COVID funding. So this is short-term, one-time funding. So keep in mind that when the legislature was allocating this funding, we really had to think about sustainability. So if we allocate millions of dollars to a program, we have to make sure that we have a way for that to be sustainable, because the IRPA funding has to be spent by 2026, or it goes back to the federal government. So there was $450 million total in IRPA funding for behavioral health in last year's session. I will say that there still is some money in the budget this year for IRPA funding for programming. Not much, not nearly as much as last year, but there was some for this is what we allocated for behavioral health last year. And so these are 4 of the main bills that we allocated funding for with that $450 million total. We also put $400 million towards housing. And these are the specific bills, some of the specific bills that IRPA put towards housing. And then we had the fentanyl bill. Who has heard about the fentanyl bill? So the Fentanyl Accountability and Prevention Bill was a very hot topic in the legislature last year. In fact, this bill was debated down to 11:50 p.m. on the last day of the legislative session. It was still in negotiations. So the legislative session lasts 120 days, and that is a constitutional requirement. So if the legislature goes 121 days, anything that passed after midnight on the 120th day fails. So 120 days and that's it. And this bill was still being negotiated at 11:50 p.m. on the last day of the session. So we will see this fentanyl bill come back this year. We're going to see it both from the law enforcement side and from the proponents of mental health advocacy and substance use disorder advocacy. So the way the bill ended up last year, 1 to 4 grams. If you are in possession of 1 to 4 grams of fentanyl, that is a felony in the state of Colorado. We will see the bill come back this year with an effort to make that 0, any amount of fentanyl to be a felony. So let's talk a little bit about the election results from 2022. So really surprising, actually, the election results this year. The Senate Democrats actually picked up 3 seats, increasing their majority from to 23 to 12. So there was a real concern that the Senate would flip to Republican, and it actually went in the complete opposite direction. So we actually picked up seats in the Senate. The House Democrats picked up 5 seats, widening their majority to 46 to 19. That means, ladies and gentlemen, we have 69 out of 100 Democrats in the Colorado legislature. That is number 2 in the nation. So 9 of the 11 new senators moved over from the House. So we have a lot of new senators, but most of them moved over from the House. So they're not what we call freshmen. We have 17 brand new Democrats and 12 brand new Republicans in the House. The Speaker of the House, Julie McCluskey, is the new leader in a House leadership position. Nearly all of our House leadership positions are held by women. 51% of the Colorado legislature this year are women. We are second only to Nevada in those statistics. Nevada has 61% of their legislature is women. The Joint Budget Committee has 4 of 6 new members. This is a big deal because the Joint Budget Committee is the all-powerful committee. They are the most powerful committee in the legislature, and to have 4 out of 6 new members is significant. Now, there's no freshman legislators on the Joint Budget Committee. We have all seasoned legislatures there on the committee, but it does change the way that decisions will be made based on who is appointed to that particular committee. They're the ones who decide where the money goes. So the election outcomes, just a couple state ballot measures. Proposition FF was the healthy meals for all public school students. And then Prop 121 and Prop 123, the Joint Budget Committee is a little concerned that both of them passed. And part of that is because Prop 123 is the affordable housing proposition, and that particular funding source is from the Tabor cap. So the money that is used to pay for the affordable housing, which is, I believe, $30 million of general fund, the money is taken from the Tabor refund. So if you got a $750 check this year, you will continue to see a Tabor refund check probably until 2025. Probably not as high as $750. You'll get another $250 check in April. But what this does is this takes a little bit of money out of your refund. That's how it's funded. So in years when there's no refund, we still have to find $30 million in the state budget to pay for this initiative. So that means money will come out of other programming. And in addition to the state income tax rate reduction passing, the general fund is from income tax, is funded by income tax. This is just the current status of the state budget in the governor's proposal. He has $42.7 billion of total funds, which is a little bit of an increase. The growth in operating budget is 7%, and he anticipates that caseload and initiation increases account for 90% of the growth. Inflation, sorry. These are the 4 key elements to secure today and invest in tomorrow that the governor is prioritizing. And what's coming in 2023? So here we have, so what's happened in the state legislature this year, because we've had so much pass in the last, I would say 2 to 3 years, as far as healthcare legislation, we're gonna see a lot of tweaking of bills. So a lot of looking at legislation that's already passed and trying to fix some of the issues with those big bills that have already passed. So we may not see any big efforts this year, like the public option or birth equity, or some of the bigger ticket items this year. We're going to see a lot of tweaking of bills that have passed in prior years. And in that respect, we're going to see some changes to equal pay. We're going to see some changes to the fentanyl legislation already. We're going to see some criminal justice reform. We'll see some bills on adult education and medical debt, and some progressive bills from the freshman legislators. So while I say that we may not see any big legislation this year, we do anticipate some, maybe some crazy legislation from the freshman legislators. I hate to say it, but we will probably see a single-payer healthcare system effort. We're going to see a lot of criminal justice reform. We have a lot of freshmen with a lot of very big ideas. So that's what we see coming in 2023. And that is it. This is my information. And we have just a couple minutes, I think, if anybody has any questions. As far as healthcare? Yes, I do. Yes, so there was an effort last year for nurse staffing ratios, a bill for nurse staffing ratios. It was whittled down into basically a study about nurse staffing ratios. But yes, I do see that coming back this year. I also see the physician assistant bill coming back. There may be some changes to it, but that will probably come back as well. That has failed in the prior 3 sessions. And I invite you all, if you've never been to the Capitol, it's a beautiful building. It's open to the public. You can just walk in. People find it intimidating. But if you're in Denver or there's a bill that you're interested in or you'd like to hear the committee hearing, please come to the Capitol. It's a beautiful building, and we're in session from January 9th until around May 6th. Thank you very much.
Well, thank you, Lisa. That was extremely informative, and I know that we've got a lot of things to look forward to this next session. So I encourage everyone to engage in happenings and don't look at legislation and politics as something that other people do. Get involved personally and understand what's being proposed and know who your legislators are. So that's part of the beauty of being in this country and being able to impact those things. So next I'd like to invite, where's Yvonne? She's like the bookends of of our summit today. The Vice President of Strategic Initiatives with the Fort Collins Area Chamber of Commerce, and she's going to help summarize today and offer some words of wisdom for future collaboration in our region. So Yvonne, thank you. Oh, you need your phone?
Who, that's tall order, words of wisdom. I don't know about that. But I so appreciate you all being here. It's always amazing to me. This event is so interesting because we have competitors in the room. We have insurers and those who use insurance and those who are paid by insurance, as well as other friends here. And yet we can come together today and learn about what it means to walk in each other's shoes, right? Understand what it means to be the insurers, understand what it means to be the providers, understand, I think all of us have the lens of the patient, even if we work in healthcare, right? What does that mean to everyone? So I think our topics today have been amazing, and we're brave to be here. And I'm super excited for next year to bring more of the business industry here and those who buy insurance and those who have employees that use your healthcare, right? To also be a part of this conversation. So healthcare innovation, that was amazing. I think I'm going to impress my 23-year-old when I say what was the word again? A chatbot. Yes, baby, I said it. That's going to be awesome and amazing. So innovation that's happening, and we just don't hear it or see about it, so I'm so pleased that UCHealth and Banner lifted that up for us today. Future of the healthcare workforce, there's a lot of work in that space, right? And so the work-based learning navigator that was here, all the stuff that Ph.D. and the other schools are doing, it's amazing work. And we're going to spend a little time on some grants that are coming up that you all need to be a part of as well. What happened after COVID? I'm sure having demographers and state people give you the statistics probably scared you half to death. You already know what happened. You lived what happened. But to see that it happened across our state and to everyone might have been helpful to you. Behavioral health, I almost wish that was last. As we walked out, because it was legislation, and no disrespect. That was an amazing report, thank you. But it might have been nice to end on, we all should take a breath, and we should all have mindfulness moments, and we should, yesterday my daughter, she graduated, I get to say that proudly, and has a job in her career field, yay for me. Because I learned from all my workforce friends how to suit her up and get her internships and get her situated so she graduates and has a job. And they're getting a new benefits package, and it's flexible PTO. You can take it whenever. You don't have to wait till you earn it. And an older gentleman in the room said, I have saved 4 weeks. What does that mean to me? And he's suddenly not having a good time, right? Because he's wondering what is happening with his savings account he created, because that's what we used to do, right? Instead of this flexible PTO. So managing all of this work with each other, with multiple generations, with COVID in healthcare is a lot to think about. So our behavioral health session was super important to us, and lots of resources for you. What's happening with doctors, right? What's happening in that physician space? And I loved a different model, right? I think consumers have, and patients, we can choose which way we want to use our primary care and meet those physicians as well and take care of us. I did want to lift up that Dr. Beth Longenecker is here. Where are you? Please stand up. Yay. And she is the founding dean of the College of Osteopathic Medicine at UNC. She's the biggest kept secret in America. Here she is. Yay. Do you want to say something? I had coffee with her, and I was blown away by her. So she'll tell you a little bit about herself, but she's like an ER doctor in
the Bronx and in Philadelphia, and she's been a dean of med schools. And so I said to her, why Greeley? And not any disrespect to Greeley, but you've been in the Bronx. Like, what the heck? And so she shared with me, and I might take a little thunder, but then you can add some more. She said, well, I've already met with the School of Communication, and they're going to create curriculum with me, and our doctors are going to learn from those who teach communication how to speak to their patients. I about fell off the chair in that coffee place in Greeley, right? Yay, indeed. This is an amazing person that we have in our community. I'm glad to lift her up here for you.
Thanks for that. So just for those of you who are not aware, we are early in the process of starting a new College of Osteopathic Medicine at University of Northern Colorado. I have been here about 6 months in the role of founding dean, and I am excited because I really look at this community as this is a great place for collaboration with our health systems. I've been in conversations with UCHealth. I've been in conversations with Banner. We're really looking at how can we create programs that are going to create pipelines to bring students from our communities into undergraduate and graduate programs and become healthcare professionals, not just in the medical school, but in our other professions such as the School of Nursing, our audiology programs, our exercise physiology programs. How do we bring all of that together? We're looking at how do we partner with our healthcare partners in the communities too, to say, can we do SIM? Can we do other things? I'm going to reach out to Ames and say, hey, your EMT students, can we do a SIM where EMT is working with medical students and with our nursing students to really see how this works when someone comes into the ER or in other situations. So this was the perfect opportunity to look at a public university with a community serving focus and to say, you know, how do we meet the needs of the state? It's been mentioned a few times that there is a physician shortage that is coming. AAMC says we're going to be over 200,000 physicians short in the country by 30. If you look at Colorado, over 1/3 of the physicians in practice in the state are 60 or older. So if you look at rural communities, that's even more pronounced, that there's a shortage in rural communities. I am an emergency medicine physician, but when you look at DOs, over 50% go into primary care. And so how do we help supplement the needs in the state? So it kind of hits all the buttons on, we have a need here, we have a great university to partner with that has expertise. We're even looking at how can we work with the Colorado School of Public Health and create dual degree programs or inform our students on not just how do you serve your patient, but how do you serve your community? Because as a physician, you are a resource for your community. It's not just all about the individual patients that you serve. So very excited to be here. If anyone wants to reach out, I'll make sure my email is available, although it's pretty easy to find. And I look forward to partnering with all of you as we move forward. We're hoping to have our first class of students as early as 25 and no later than 26. So.
She didn't know that I was calling her up here, but I told her she should come to the summit and meet people, and so now you've met her. So go find her and talk to her afterwards and make connections with her for sure. And the legislative update, that's so important, and we appreciate all that information because last year, 2 weeks before the end of the session, was legislation with mandatory staffing. 2 weeks before the end of the session. And so the Northern Colorado Legislative Alliance, which is a group of the Greeley, Loveland, Fort Collins Chamber, and then Economic Development from Greeley meet and have for 36 years or 42 years. It's been a long time. Carol Salter will know. She's not been a member the whole time, but it's been a long time. And then we had an NCLA healthcare committee on the side that was looking at healthcare things over the last few years, and a lot of it was prior to COVID and things like Medicaid folks getting all their primary care at the emergency room. Why is that happening versus going to seeing their physician? Those sorts of problems and situations. And so we actually did a pivot, and Craig Lazinski and Jesse Willard are leading that charge of that committee, and Carol Salter's on that as well. So if there are folks you want to ask questions about, the NCLA Healthcare Working Group is now focused in on the legislative session and looking at bills that affect the business of healthcare. We're not going to look at things like a PA gets more, well, maybe that's something we'll look at, but if somebody can give a shot that couldn't give a shot before, that's not something we're going to be looking at, but the healthcare economic business. And so really, if you're interested in that, you want to read bills, or you have expertise in an area, you're like, I am primary care Medicaid expert, we'd love to have you because that bill might come out and we'd like for you to read it and give your expertise. This NCLA Healthcare Working Group will then give their information to the NCLA group and their lobbyist, Sandra Solon, and we'll decide whether they take that information forward. But instead of being flat-footed and going, how the hell did this happen and how do we now respond, we want to be in that offensive place, not defensive. So if you're interested in that NCLA Healthcare Working Group, come talk to those folks or myself, which would be great. Sector partnerships. I absolutely bleed sector partnerships. And the reason why I do is I was on the, make sure I get you out of here on time because I'm between you and lunch, and I know that, so I will get you out. So I was on, well, the owner of Columbine Health Systems came back from a national conference and says, we have to get involved in our workforce investment boards. What are those? And I said, I don't know. He goes, find out. So called around and found the folks at Larimer County Workforce Center at the time, and we go and meet with them. And you know, if you meet with people and ask them about it, next thing you know, you're on the board, because that's how it goes, right? It's like at church. If you say, I think we ought to do this picnic, you're now in charge of the picnic. Don't say it out loud. So next thing you know, you're on the board, and then over time, you become the chair of the board. And through that time, it was an amazing way to learn about how government works and how workforce works and how the federal dollars flow to the state, to the counties, and all of that. But I felt as an industry representative that it was a huge disconnect between all this work that was happening and industry. And I would go to conferences. Oh my gosh, they sent me to Vail like 3 times in Breckenridge, and I was on the 54th floor of some building in Denver for a conference. And sometimes I'd be at a table with 12 or 15, well, 12 people, and I'd be the only industry person at the table. And all these wonderful people from workforce system, they'd say, what does industry think? And I think, holy buckets, I can't be the person representing industry. Are you kidding me? Like, I have lots of opinions and I can talk, but really, should I represent industry? And then you go drive back down I-25 and you go back to work. And not much more happens. And a couple of times I was on advisory committees for Front Range Community College and UNC and those things that are mandated as part of their accreditation. And I remember once we were in the ideas of building a campus in Windsor. We were going to expand Columbine Health Systems. And at that point, I went to an advisory board of one of those nursing programs, and they said, oh, well, we haven't seen all of our new grads hired by June or before they graduate, so we're going to cut the program back by 10 people. And I was like, holy God, we need you to up it by 30 because we're about to open another nursing home. And they would say, well, this is where we are. And again, people doing great work, but not working together. And so as it turned out, Governor Hickenlooper, was at a National Governors Association back in 2013, and he learned about next-gen sector partnerships. And I think the reason why he grabbed them and brought them to Colorado, we were one of the first states, now there are 26 states that play in this space, we were one of the first, is because he was an entrepreneur, right? He owned the Wine Coop Brewing Company, like he got it. And he brought this model, and again, you get invited, and this time we were up at near the Colorado Mills Mall at the Marriott across the highway there, and they introduced the governor who says, I'm going to be bringing this forward, and was his representative, and then the representative from M.Ed and higher ed and the community college system, the K-12 system, and workforce and all those folks, and they all said, we're going to back this. And I thought, oh, here we go, another big government program. And then they brought up 2 people, Lindsay Woolsey, who lives in the state of Washington, and John Melville, who lives in Los Angeles, and now they've added Francie Gens, who lives in Virginia. And those 3 people run the Next Gen Sector Partnership for the nation. 3 people. And the 2 of them, John and Lindsay, talked about sector partnerships, and they said it is industry-led. And I said, oh, hell yeah, we're going to play. Because we're the ones who hire. We're the ones who move the economy, and all of our wonderful public partners support that work. And all of our educators, I remember once meeting the new dean, I guess it's called a dean, no, head of the Department of Social Work at CSU, and we sat down at a restaurant, and I said to her, well, what are you going to do to make sure I have a good product to hire? And she looked at me and she said, product? I said, you create my workforce. I hire your product. And as an educator in higher ed and social work, she never put that connection together. She trained social workers, which was great, but not to say that I'm going to be hiring, not that connection to the industry. And she said, you've kind of changed my attitude about things. She's now a dean someplace. I might have had a little bit to do about that. Just kidding, just kidding. And so we, and Evan Hyatt's been with me this whole entire time, I made the mistake. It was a 2-night event, and I didn't stay the first night because CSU was playing Air Force, and I have season tickets, and by God, we're going to watch some beat 'em in basketball, which we did. And when I came back, they said, you get to start the sector partnership because you're from the nursing homes, and right then was when UCHealth and Banner were sort of figuring out who was going to be in what town. Do you remember that? And everybody was upset and nervous, and I would get calls, and people would say, if I call 911, where will I go? I go, well, the hospital you want, but if you're really serious, to the closest one. But people were worried about how things were going. So we launched the sector partnership. And so across the country, the healthcare sector partnership and the manufacturing one for Northern Colorado that started in 2013 have been lifted up as national models. Are you sure? But here we are. And the sector partnership that is running today has now been going since 2013 with new leadership and new people. And Jonas explained to you the work that they're doing, the committees that they're working on. And truly, we have a list. Adam Crow has cultivated a list of 70 public partners that help our sector partnerships. And so over these 13 years, all of our public partners have added roles. Andy Yost was recently hired for work-based learning, right, with Weld County. And it's amazing because he was a school teacher at Roosevelt High School for 25 years. And having him now on the other side of the equation to help us with connecting work-based learning to students. So our public partners have lifted themselves up to help support sector partnerships. So when I went to the chamber, one of the reasons why I went is they said, you get to help add more sector partnerships. And I said, oh, hell yeah. And so when I got there, we have manufacturing and healthcare. And then construction had launched 2 weeks before COVID started. So they tried to do some things, and Ames was super helpful, and they've done some things there. And then they relaunched in February, and they did a construction con event November 2nd. They bussed in 650 high school kids to experience construction. They got to work on big machinery, play with concrete. They had a career fair. They had business to business. They raised $48,000 in doing that because the industry paid for it, right? That's the strength of a sector partnership, as industry says, I can step up, I can help, I can sponsor, I can donate, I have somebody that I can give, I have a program, I can move it forward. The essence of sector partnerships is that those who play in the space of sector partnerships recognize they need to lift up their industry collectively together, that you can't solve it by yourself. So we have recently launched the hospitality sector partnership. So that's hotels, retail, food and beverage. And when we did the Purple Wall launch for food and beverage, their biggest concern and question was, well, they have 3 things. They want to work on workforce and talent like you all do. They want to work on regulations, liquor laws, and other sorts of things that they need to work on. And then the third one is customer experience. And for them, it's a couple of things. Are they providing the best customer service? But what's happened post-COVID at your restaurants? Your favorite sandwich that you liked that was $8.99 is now $12.99. And they don't have avocado on it because they can't get it. And then it took 10 more minutes to make it. And customers walk out the door and write a nasty Yelp. And these little industries, these little restaurants are trying to make it, right? And so they'd like to work on that customer service. And they'd also like to bring people back to local because we got so used to Zooming on Amazon that we kind of forgot about Old Town, or we forgot about Midtown, or we forgot about a great restaurant in Greeley or Windsor. And so, but then, and this isn't a political statement, minimum wage comes up, right? Mandatory minimum wage, which is going to continue to be a conversation in our state, in our area. And the restaurateurs said, I'm afraid to speak out loud and to say, I'm not for minimum wage. They want their employees to be paid well. They want to give them sustainable wages. But if it's mandated, it makes it harder to do, the flexibility and how they can move it themselves, and how high can that $12 sandwich go to. And I'm afraid to say it out loud. I'm afraid of retribution from my customers, from regulators, from the world. But if I come together as a partnership, we now have 300 names in our hospitality sector partnership. When you call the mayor of Fort Collins and say, the hospitality sector partnership would like to visit with you, and here are our 300 members, she goes, I better show up, and I better listen. And so to join a sector partnership, many of you here are members of the sector partnership and attend. There's no fee. I call it a confab of the willing. People who want to lift up their profession know that they're going to win sometimes, win a little bit more sometimes, maybe don't win on that one, but lift it up better. So with the construction sector partnership, real quickly, what do you think of when you think of somebody working in construction? Oh, you can say it out loud. Somebody with a butt crack and falling off a building, right? So I was just on a call a little bit ago today, and it was a man from cybersecurity. What do we think is the stereotype of working in cybersecurity? He said, no, cybersecurity is not a white male with a hoodie in his mother's basement trying to hack into a federal building. Do you know that you can work in cybersecurity and make $90,000 and not have to go to college? I just learned that this morning. In order to fix this workforce shortage and the things going on, we have to change the stereotypes. We have to change what's going on. We have to make nursing sexy again and cool. We have to make wanting to be a doctor amazing. We have to make wanting to be a CNA and an MA awesome. And we can't do that by ourselves. And if we continue to work in our silos trying to do it, we're not going to get there. So joining a sector partnership, in my mind, is the best way to do it. And the reasons why is there's a whole lot of money raining down. I call it ARPA. Maybe because I'm in healthcare and IRPA sounds like throwing up, so I kind of left it. Sorry, but yay. I had a resident who would say, I think I'm going to IRP, and so maybe that's where that came from. So there's a whole lot of money raining down, one-time money that if we don't grab it, it's not going to be here anymore, and by God, if you're a health sector partnership, you ought to go grab it. And so there's actually a grant coming out at 7 a.m. on Thursday morning. That's going to be lots of money. $85 million. It's House Bill 22-1350, known as the Opportunity Now Grant. And they have piloted 4 target areas that have priority to get this money: healthcare, childcare workers, K-12 teachers, and infrastructure, meaning construction. So you're a targeted place. So it's coming out at 7 a.m. on the 1st. A whole bunch of us are going to be busy reading, and we're going to take it home, and I'm sorry, I'll try to have a mental health moment, but we'll have to get through that grant and understand it. And then we're meeting on Friday morning the 2nd at 9 a.m. to see if this sector partnership should go after those monies. There's planning grant for $49,900. There's a seed grant for $1 million up to $2 million, $500,000 to $2 million, and then there's a scale grant of $5 million to $12 million. There's money out there, and you individually can't go after it, but this sector partnership can do that. Then last week, Wednesday, we learned that there's a work-based learning grant. We can get $500,000 to do that. So we're looking at that at this point. We've created an infrastructure with our sector partnerships. We're just launching nonprofit sector partnerships, so we have 5 if you've been doing the math. We hope to launch financial services and cybersecurity. And we think we're going to go after that $500,000 to pay. This grant pays employers. If you take a full-time work-based learning student, you pay them, and they work for you full-time, they will give you $10,000. Now, there's some rules and some processes and things about that. If you will take a student for 8 hours, just as a job shadow with you for 8 hours, you can be paid $1,500. And the reason isn't to pay you to make you do this, it's to say we recognize, the legislature recognizes it costs you money to do this work. You may have to have a champion. You listened to the panel and talked about all of that. So we're working on that. And the last thing I want to lift up is that this region is really, really, really coming together well. And the region, they divide sector partnerships into economic regions of the state. So we are Region 2, if you didn't know that, and that is Larimer and Weld. Duh, right? That's our labor shed. It makes sense that we would be that region. And so we've been working together. All of you, many of you may know, have heard of Talent 2.0, which was a talent initiative part on the Larimer County side. And over the last year, we've been working together with our Weld County friends. And Adam, I'm going to say it. The name of our partnership is not Talent 3.0. We're a little more creative than that. It's called NoCo Works. That took a whole lot to think about, didn't it? Yay. And so part of that effort was the Community Foundation of Northern Colorado, the Weld Trust, and the Fort Collins Area Chamber of Commerce hired Colorado Succeeds, which is a group out of Denver, put together by business owners who wanted to help education be the best it could be. And so we hired Colorado Succeeds to do an asset map. They're actually calling the K-20 Pathways to Employment Report. They've interviewed many people in our ecosystem, all of our community, higher ed, universities, workforce systems, industry, businesses. Some of you in the room have participated in it. And that report's coming out on Friday. What's interesting is Weld County is such a big county. Oh my goodness. And some of Weld County actually sits at the Longmont School District. Who knew? And Longmont School District, after reading the report to be sure was factually correct, said, oh shoot, we forgot to have you interview Frederick and Meade high schools. Oh crap. So we're going to send it out on Friday, and then we'll add those 2 high schools together. And it will actually back up, and we'll send it to this group. We have your email list. It actually backs up work-based learning and all the things that we've talked about today. And we can use that data to inform us and to help us write these grants and these opportunities. As these efforts come, as our state is so focused on helping you return back to pre-COVID areas and places, the sector partnership is absolutely the best place for you to be. It is absolutely the best place. They didn't pay me to say this either, but I'm going to ask for money later, so just kidding. So I'm going to end by saying thank you for being here. Thank you for taking time out of your busy schedule. Thank you for being behind today. I know some of you have been trying to answer emails. Some of you are like, oh, God, I go back to work and answer 19 things. It's important that you come. It's important that you hear from your neighbors and your friends, and you walk in each other's shoes for a little bit of time. And it's good that we celebrate healthcare and the wonderfulness of healthcare in Northern Colorado, and that we walk away going, Northern Colorado Health Sector Partnership kicks ass. Have a great day.
She made it all the way to the end. I didn't know if she was going to swear, but we got one. Just a couple of quick things. We got some thank yous to do, and then I'll get you out of here, I promise. We're just about there. But we do have one drawing, right? All right. This is from Colorado Visiting Nurse Association. Looks like Eric Siegel? Eric? All right, you get an awesome basket. Thanks. And I want to thank all of our sponsors. I'm going to run through all the names again. Just bear with me. Again, we cannot do this without them. I really appreciate all of them. Our platinum sponsor was Fort Collins Chamber of Commerce. Gold sponsors were Anthem, Old Town Media, and UCHealth. Bronze was 50 Plus Media Solutions, Advanced Medical Imaging Consultants, Associates in Family Medicine, Village MD, City of Fort Collins, Eye Care Associates, Front Range Community College, iHeart, OCR, Pathways, Senior Voice, Summit Stone Health Partners, UCHealth Plan Administrators, and then our event sponsors were Allergy and Asthma Center of the Rockies, Centennial Area Health Education Center, CAHEC. I should have just gone with the abbreviation. Century Park Associates, Colorado Visiting Nurse Association, Emergency Physicians of the Rockies, FNBO, Jet Marketing, North 40 News, Northern Colorado Rehabilitation, Northern Colorado Long-Term Acute Hospital, Sinorama, Surgery Center of Fort Collins, and the Women's Clinic of Northern Colorado. Just one more time, let's thank all of our sponsors, please. We couldn't have done this without sponsors. We also couldn't have done this without our logistics team. And I want to thank Nikki, especially, and her entire team at the Place Setting Company for putting this on. Took care of all the emails, all the planning. It was a huge amount of work. And wrangling a volunteer group like the Northern Colorado Health Sector Partnership can be difficult, and they do a fabulous job of doing that. So thank you, Nikki, and your team. I want to thank Tyler in the back. We've had about 30 people online all day, and he's been running video to them so they could see the slides, see the speakers, hear everything. I took care of all the audio, video today, so thank you and the team here at the ranch. And finally, I promised we'd put these up again. Yvonne did a great job. I'm not going to talk anymore about the Health Sector Partnership, but if you want to get involved, this is how you do it. And again, make sure you get the program if you want the slides, if you want to share this with your team back at the office. We'd love this information to get spread far and wide. So definitely grab those slides and pass those around. The centerpieces on your table, those were donated to us by CAHEC, actually. So those are yours to take home. If you want, you can fight each other for them. You can just grab it. There's an empty table up here where nobody's going to be claiming it. So if you need a little plant for your office, that would be a great thing if you could help us by taking those home. I think that's it. So again, thank you so much, everyone. Really appreciate you being here. Can't wait to see you here again next year. Have a great day.